Now, Dr. Haley is the Chief Executive Officer at UF and is the Vice President of Health Affairs at the University of Florida. And today he's going to be speaking on something that's really relevant and it's important, and it's an issue that we're dealing with now. And the great thing about the summit is a lot of what we're talking about in the summit is things that you have requested that you wanted more information about. And so we wanted to dive right into a really important issue that's happening now, and it's the COVID issue, and it's getting bigger every day. And we wanted to make sure that Dr. Leon Haley can actually give us some information about how it's impacting our communities and what we can do now to be safe. Hey, Dr. Haley, thank you very much for taking the time out to present the information for us today.
Oh, you're welcome. Hope you can hear me fine. Hope you can see my screen.
Yes, we can.
Okay, excellent. So probably over the next 15, 20 minutes, what I really want to do is take a very significant issue that's occurring right now, as has already been stated, and try and succinctly say, here are some of the key implications of, kind of where we are with the coronavirus and implications for the African-American community, and a little bit around sort of treatment options and kind of where we are today. Because we are still, if I would go back to our Hospital Incident Command Center, which we've had open since March 2nd. So we're around 260 days of keeping our Hospital Incident Command Center open to really manage this virus as it's worked its way through the world, as well as the United States through Florida and through Duval County and Jacksonville. So really quickly, just give you a little bit about background information. I feel it's always important to understand sort of the origins and how we landed here, talk a little bit about transmission, which I think we have pretty good understanding of, but still some reluctance, I think, from folks to really understand that and then do the right thing with it. A little bit around current data, which of course, as you know, changes frequently. So the data I'll show you is what things were as of Wednesday, but they move fairly quickly. Implications for African Americans and the treatment options, which are few on some level, and then think where we are next step. So this is it. You wonder what has scourged the earth over the last 200 plus days, or actually almost a year if you go back to China. This is it. This is a single-stranded RNA virus. This is the coronavirus. This is obviously the graphic representation of what that looks like. And it has, as I think we all know, wreaked havoc, not only from a medical standpoint, from an economic standpoint, and for the purposes of today, as we know, has revealed, or not revealed, enlightened what we're all very aware of around health disparities in African Americans and other people of color, and as well as it shows the economic divide in our community. But it is a reminder that there are actually many types of coronaviruses. So coronavirus is something we deal with on a regular basis. In fact, it is the common cold. So when we think about coronavirus, we're specifically, when we talk about COVID, we're talking about COVID-19, which is a new version of coronavirus, but there are coronaviruses that are in existence all the time. There are people that have studied them for years. This is obviously, like many things, a new manifestation of the coronavirus, but we deal with it on a regular basis, which is important because when I end up and talk a little bit about the vaccine is tough, because if you think about it, there is no vaccine for the common cold. We can get that once or twice a year. We get it every year. And so the ability to come up with a vaccine for a specific coronavirus is difficult, although it feels like we have a lot of promise as it relates to it. It's clear that coronavirus can be spread fairly easily. It is largely something that can be spread from a respiratory standpoint, but there is the contact piece that we have to be careful of and have to be aware with on a regular basis. And so that's why when you'll hear the conversation around treatment options, one of the treatment options or one of the options for us is always wearing a mask, wearing glasses when that component is necessary, or depending upon where you are, and washing your hands frequently is really a key to it as it relates to the coronavirus. So where did it start? I think you probably are familiar with this, but sort of the origins go back to Wuhan, China, back sort of actually really just about a year ago when things were starting to sweep through in China. And we think that, although there's lots of conspiracy theories out there about being created in a lab, and which, obviously could always be a possibility, we think that that's not it. We really think it's really a more of a transmission from an animal through a host to a human, right? And that has happened before in history. So the current theory is that potentially from a bat, the pangolin is a pet in China, and apparently is the intermediate host. It does not get infected by coronavirus, but quickly it has spread to humans, and that is the current theory. And part of where that is as if you've ever been to China, unfortunately, there are some markets there where the sanitation and quality are less than to be desired. And so part of the concern and a lot of the original tracings of coronavirus can actually be pinpointed down to a market that was in China. And we think that that's the thing. This is not the first time that that has happened. So in our history, and if you go back, and certainly if you're in medicine, we have had other viruses that have been transmitted the same way, right? Which is through an animal, through an intermediate host over to humans. And so SARS, which was a very significant virus back in the early 2000s, was something that we were very concerned about back then, but much unlike coronavirus, we were able to get a better handle on it much more quickly and able to stop the spread before it really became the pandemic that coronavirus has. And the Middle Eastern respiratory syndrome also was something that we've seen in the early 2000s, but also did not have the same spread to the same degree. This is Dr. Li Wenling, who died from coronavirus. But interesting enough, he was one of the early folks who was starting to warn about it and said, we are starting to see this respiratory virus in China. That's his letter actually off to the right, where he talked about warning it. And unfortunately, a lot of his concerns were censored by the Chinese government. He was unable to really convince people that this was a big deal and things that were spreading. And unfortunately, he later became a victim of coronavirus, as this was something he was studying. So yes, part of the initial spread, unfortunately, is because people were trying to keep things under wraps and not really allowing sort of the appropriate treatment parameters to be initiated. And that's how, unfortunately, why we end up in a little bit of the challenge that we have. So this is how it spread, mainly through respiratory droplets. And there's a key component of, what we talk about contact time, right? Which is, it's not just you and I passing in a mall or a hallway. There needs to be some contact time, which means typically you're with somebody who has the virus in close proximity for some amount of time. Not an instant, not 10 minutes, not 20. We don't have a good feel for that, although there is some literature, but close environments. We also know, if you've heard, we want people 6 feet apart, but unfortunately, for somebody who doesn't have a mask on, who potentially sneezes or coughs, that can go up to 20 feet, right? So that's why you've heard some of the 20 feet parameters as well. So it does spread through respiratory contact. That's why indoor events are a big challenge. That's why, the subways were a big challenge in New York, very early, close environments. Those are all big challenges for us. And it can spread, although it's difficult, but it can spread by contact. So if you sneeze on the door handle, for example, and you have coronavirus and somebody comes right behind you and grabs the same door handle and then rubs their mouth or their eyes, that's a potential way for it to be spread. So that's why the hand washing is important. That's why putting the masks are important. That's why keeping your distance from folks are important as we move forward. So a mask would definitely help, and you're right. You always have to worry about, did the person in front of you wash their hands? So you should assume they have not. So having, your alcohol is important, is something for you to help protect yourself. Once it does spread, early on, and although coronavirus has been, I will say from a medical standpoint, been a very, very interesting and fascinating disease. So early in coronavirus, what we were seeing was this. So the abnormal chest x-ray, somebody who presented to the emergency department or to the hospital with fever, cough, and shortness of breath. That was the initial trilogy of coronavirus, and people would have significant respiratory illness, oftentimes a pneumonia, oftentimes having to be on a ventilator. One of the things that we know around coronavirus since then is it is a respiratory illness, and these are still some of the trilogy, but we now increasingly know that people present with a variety of symptoms, right? Ranging from loss of taste and smell, diarrhea, even sore throat, renal disease. So there are just multiple ways that the disease has manifested itself. Also blood clots. And so as we've begun to treat coronavirus, we learned that there's no typical presentation, quite frankly, because people are showing up in multiple ways, and people are, as we know, there are folks that are asymptomatic or have very mild symptoms and are still spreading the disease. But this is still the hallmark. The other thing we've learned over time, very early, particularly in New York and in Seattle, very early, everybody was put on a ventilator. And what we've later learned over our science, and as we become more knowledgeable about the disease, that's a very big challenge, particularly if you're elderly and have comorbid factors. And so we've tried real hard over the last several months to not put people on ventilators unless we absolutely have to, because the ability to get off is really a significant challenge. So aggressive coronavirus, people develop severe pneumonias, and very important that sort of the elderly population is at risk. And it's still at risk. And that's one thing that has been very consistent throughout coronavirus. So ages 65 and above are a big challenge. Ages 65 with comorbid factors, and I'll show those in just a few minutes, or even a bigger challenge. And certainly we as African Americans, we as African men, no doubt have hypertension, oftentimes high cholesterol, diabetes, and obesity. Those are very significant comorbid factors that continue to show up as we move forward, because we really want to make sure we're keeping people off of virus. Now, the coronavirus I'm going to show you some numbers in just a minute. It is very significant, but in many respects, it does pale in comparison to some other viruses that we've had. So the Spanish flu, which you often heard the comparison of coronavirus to, killed 50 million people worldwide in 1918. And so we've had a series of viruses that have impacted the world over the last 100+ years. And so this is not a new thing. Unfortunately, we should have been more prepared as a world, as a country, to prepare for it, because we have lots of history around it. But through lots of different reasons, that's probably a whole different conversation. We weren't ready, and we pretended it wouldn't happen. But it is a significant virus, but there have been other significant viruses in our culture and in our history in the past. So as of a couple of days ago, 51 million cases of coronavirus across the country, basically touching pretty much every continent, every country in the world. 1.2 million deaths in the United States, 10.3 million cases, 240,000 plus deaths. And in the state of Florida, 858,000 cases, 51,000 hospitalizations, 17,000 deaths. So these are big numbers, right? And people talk, well, it's not as bad as the flu. I can tell you the flu doesn't do this, right? These are not kind of numbers that we see with the flu, and very few other diseases have we seen this. In fact, we're pretty sure that by the time 2020 is over, coronavirus will be the leading cause of death across the country. So really significant numbers. I'm actually in the state of Texas getting ready to visit my daughter. There are well over 1 million cases here. And so starting to see hospitalization numbers. I looked at our hospitalization numbers this morning, and they're starting to rise, as we've seen. And then Duval County, 37,000 cases, 1,300 hospitalizations, 544 deaths. So these are our colleagues, our citizens, and largely when we look at the demographics in our hospital, for example, about 60% of our hospitalized patients with coronavirus are African American, and about 30% are white, and then obviously a scattered few others. That's the exact opposite of the split racial demographics in Duval County, right, which are 60% white and 30% African American. So it is. Yes, sir.
People have been asking questions.
Okay.
One of the big questions has been why the numbers are so skewed and so high when it comes to the impact on African Americans.
It's coming up. Hold on. I'm getting there. I've got a couple more slides. So this is hospitalizations, but the big issue is basically, there's a couple of different factors. One of the big issues is comorbid diseases. So the big diseases that we have seen that are impacting coronavirus are hypertension, diabetes, high cholesterol, obesity. And unfortunately, the African American community, not just here in Duval County, Florida, nationwide, have greater, we have that more, right? From a percentage basis, more of our citizens, unfortunately, have one of those diseases. And if you have multiple of those, then we are seeing, your risk factors being even higher. The other issues that are playing into it are sort of the at-risk workers. So many of the folks early on, the jobs that had to stay open, right? So the grocery worker, people on the front lines, right? The housekeeper in the hospitals, those kind of things, the meat plant workers, for example, across the other parts of the country. Those tend to be people that are African American or people of color. In New York, the spread was people who still had to go to work, couldn't pivot to being at home, and had to be on the subway. So those are things that are impacting why we are at a greater risk. And, then the usual things that we tend to talk about, sort of access to healthcare, right? Our ability to see primary care physicians on a regular basis, waiting until the last minute to go into the hospital. This just gives you a quick snapshot of COVID and underrepresented minorities. This is CDC data, so this is public data right off the website. And you can see that, if you are a person of color, American Indian, African American, Hispanic, your risk of, the number of cases, the hospitalization, and the death rate are all significantly higher. And so these are things that we're continuing to try and understand, make sure we can understand the health disparities that come with that. As I talked about before, these are the comorbid risk factors that people have. And so, when we've looked at it, the three at the bottom, diabetes, cardiovascular disease, and hypertension are big risk factors. And unfortunately, as was said very early in the equation, when you guys started the session today, we are at greater risk, not taking care of ourselves oftentimes, not having access to healthcare, having historical attributes to hypertension make us at greater risk. And those are things that we need to be aware of. As we shift, I'll try and answer some questions at the end. I know they're flying in, but when schools reopen, this is the other challenge. So when schools reopen, not everybody has the ability to be educated at home, Wi-Fi access. So people have to go back to school. And unfortunately, what we've seen is the numbers start to go back up. And until we can get a better control of it, then the kids go back to school and then they come back home and infect their parents or their grandparents. And so those are things that we see because not everybody has the ability to learn from home moving forward. And so that adds to it. So other things that we see just in general, African Americans at risk for hypertension, diabetes, stroke, so even without COVID, we're already at a significantly increased risk factors to die from those particular diseases. Then when you add in some of the economic challenges like unemployment, poverty, inability to see a physician, smoking, not active, obesity, these are things that unfortunately we outpace the white population with almost fairly significantly. Our folks are actually doing some additional data that we're looking not only at, just obviously deaths and hospitalization, but, lives lost. And can we start to underestimate, these are now significantly, we already have a challenge in terms of life expectancy. And now with a disease like COVID, we're starting to challenge that even more. And so you can see from some early data that our teams have done, there's a significant impact to COVID, because it is hitting people, when they're still relatively young. And so we're starting to see data that would suggest that people are dying, even earlier than what their life expectancies would be. And then those impacts are starting to, again, show up looking at, African Americans with 13 years of potential lives lost. So this is early data. Don't quote me on all of this, but we're starting to see the impact of not only people that are African American in our hospitalizations with deaths, but even deaths at an early places. So just to finish up, treatment, there is no cure, not right now. So what we have is how to prevent it. So you got to wear your mask, particularly if you're coughing or sneezing and not going out, particularly wear your shield, having your distance. Those are critical things. So 6 feet at a minimum. So try and avoid close contacts. Thanksgiving is getting ready to come up. If you're about to have Thanksgiving in a household that you're not normally in, I would actually recommend you don't go or do it virtually, or if you're going to do it, make sure you're outside or keeping your distance or something. That's the big challenge that we've got right now. And then the easy one is really hand washing, right? So you can carry your alcohol, you can wash your hands. Those are all critical factors. And make sure your alcohol has at least 60% alcohol in it to make sure that it is effective. For those of us in healthcare workers, or if you're traveling, we need extra PPE. Those are important things. And here's the data that just says it works, right? So you've heard us early in the equation talk about flattening the curve. And the reason why we're trying to flatten the curve is make sure that we can continue to, prevent the spread, but also making sure we have health system capacity to take care of it if things start to, really kind of pop back up. So again, when you get infected, if you get infected, unfortunately, and we're starting to see more of it, case volumes are 100,000 cases per day in the United States. These are the typical symptoms that people are seeing. So 14 days is kind of the time frame that we talk about. So if you are exposed to the virus and if you're positive, you've got probably a minimum of 14 days that you need to isolate yourself if you're not in hospital, for example. Most people actually do have a mild disease, but if you're sick, obviously you need to come to the hospital. If you've never been tested for coronavirus, this is basically what it looks like. So it is a nasal swab, and you can see we have to stick it way far in the back of your nose, really to that, retropharynx almost. And it's not comfortable, right? In fact, one of the keys is if you start to cry a little bit or wince, that's how we know we've been infected. We've been affected. Now we're working on different things like saliva. We can do a little nasal swab. So we're getting to where we can test a little bit better, but this is the gold standard still in terms of testing. Social distance is a treatment. And then there's a lot of things that are in play right now. I won't read through all of these because there are a lot of things that we're working on. Probably the most effective inpatient therapy has been steroids. Actually, all of these other ones have been studied. And you heard about hydroxychloroquine, you've heard about remdesivir. Those have been mildly effective, if not effective at all. Now we just got an emergency release that we can start using the anti-monoclonal antibody that the president received a couple of weeks back. So we're going to start working through that. And then obviously the next thing on the horizon is, can we get to a vaccine? And so you may have heard or read that earlier this week, Pfizer announced that they believe they have a vaccine that's 90% effective. I'm not sure what the 90% of what is and how they've kind of tested through it, but we think that that's coming down the pipe fairly soon. And there's a number of other other vaccines that are in process that we're looking at to figure out. These are all phase 3 trials, which means they're testing it in humans in real time and doing a randomized control study to figure out, who got it, who didn't get it, and whether it's working or not. But there are things that are coming down the pipe. And then we've got to worry about how to get everybody inoculated, right? So let's say we have a vaccine and we want to inoculate the entire country. Inoculating 350 million people is going to be a challenge. And who goes first and how do we do it? How do we distribute it? Those are all things that we've got to do. So that's a very quick run through for coronavirus, what the implications are for all of us, for our country, and certainly why we as African Americans are at, sort of those significant risks. So I'll stop there and try and work through the questions.
Oh, that's really a great question. Hey, that was a really great presentation and very thorough. Thank you very much.
You're welcome.
Doc. It was great. Now, one thing people wanted to know is about the symptoms. What symptoms would lead someone to believe that, they should definitely go get checked for coronavirus?
If you have, the worst symptoms are really, if you have a fever, cough, shortness of breath, that's kind of the trifecta. You definitely need to be tested, particularly now. And if you really can't breathe, you need to go to the hospital and get admitted to the hospital. I would say the other things that people should worry, if they have sudden congestion, for example, and have noticed that, I'm not normally a person with allergies and now all of a sudden I'm congested or have a runny nose, that actually can be coronavirus. If you have a sore throat that you've not had before, that could be coronavirus. I had one of my colleagues from Atlanta had, severe chest pain the other day and ended up having coronavirus. So there's a lot of different symptoms, but definitely the big three are fever, cough that's unexplained, and shortness of breath. If you have those, then you almost certainly need to be checked. Almost every place is going to check. If you want a coronavirus test, you can get it now. So if you have any concerns, you should go ahead and get tested.
Whether you're asymptomatic or not.
Exactly.
Okay. And another question, people have been concerned that the swab goes too far back in their head. Someone said, I don't want them poking me in my brain.
That's true, but that's the definitive way. Is that, listen, I've had 3 tests. I got to have another one in about a week. But yeah, it's got to go way far back there. Here's the problem, though. Here's part of the challenge. Even with that test, there's still about a 25% false negative rate. So it doesn't get all of them, even though it goes back there. And then the saliva test we're working on right now. My colleagues in Gainesville are working on a saliva test. The problem is those are easier tests, but their ability to miss coronavirus is a little higher. So it's kind of the dynamic you have to deal with. But yeah, that's why the best thing is to try and not get coronavirus and wear your mask and keep your distance and, don't travel as much as you can.
Now,
Dr. Haley,
it
the
seems
last, can we get one last question? Why is it important to get a flu shot? I'm sorry, Dr.
Oh
Phillips.
yeah, great question. Flu shot, absolutely. Because here's the thing: there's two reasons. One, you don't want the flu either, right? That is not a comfortable disease either, and you certainly don't want to have two pandemics at the same time. We don't want to have coronavirus and a flu going around. But we also have some early literature that suggests that if you get the flu vaccine and then you later get coronavirus, your coronavirus is much less severe than if you had not had the flu vaccine. So three reasons to get the flu vaccine. One, you don't want the flu. Two, we don't want dueling pandemics. And three, there's early literature that says it actually helps if you get coronavirus on top of it.
now we're running out of time, and there's some questions we didn't get the opportunity to get to today. We'd like to move on. Where can people go if they have some final questions? And
Maybe if Dr. Haley can see the questions, if he could maybe type a response.
Yeah, I'll type a response. I have to step off in just a minute, but I'll type a couple responses. And you can also, right there on the screen, there's the COVID-19 at flhealth.gov that can answer some questions. There's a hotline center that's available 24/7 as well. We also, UF Health, we do a community forum every month. So I believe our next one is on December 3rd. And I'll have some of our team share that information, and I also try and update folks with that as well. So thank you for this opportunity.
hey, thanks, Doc.
We appreciate you.
You're welcome.
And so today we're going to talk about identifying and screening who's at highest risk for prostate cancer. And that's very important, especially in the African American community, because we're part of that. And I'm going to talk about why. My specialty is urologic oncology, which means I take care of cancers of the urinary system, and prostate cancer is one of those. So let's get going. Go ahead, next slide, please. Do I have it? Okay. Can you guys see me? Do I have it now?
Yes.
Yeah, we can see it. It starts with objectives.
Right, exactly. So today we're going to talk about how to identify, which men who are at the highest risk for prostate cancer. We want to understand why they are at the highest risk, and also know how to screen these men as well. And so, despite what you probably heard in the past about prostate cancer being slow growing or benign, not problematic, that is totally false. Almost 200,000 men will be diagnosed with prostate cancer this year, making it like the most commonly diagnosed solid organ malignancy in men. So when that many people are being diagnosed, that is not something insignificant. And even furthermore, of those men, more than 30,000 of those men will die of prostate cancer this year. And so again, when you got that many people dying of disease, you cannot just write that off and say, that's not a big deal. That's a big deal. So what are the risk factors? So the biggest risk factor for average risk men is just getting older. Most of the prostate cancers that we diagnose are in patients as they get older, especially over the age 50, and 60% of the time we diagnose these people after the age of 65. And so the biggest risk factor is getting older. But then in terms of high risk, that's kind of where the money is really. And the reason why I say that is because when we diagnose low risk prostate cancer, most of the time now we're just observing it. And we're trying to even figure out ways to just identify the people who are at higher risk and diagnose those cancers, because of the fact that even the process of diagnosing a cancer has some risk associated with it. So if we can just kind of narrow it down as much as we can to who's at highest risk, then we can save a lot of morbidity that way. So the high risk people are people with family histories of prostate cancer. So having a first degree relative more than doubles your risk of having prostate cancer. The other high risk category is African American race, because we're more than twice as likely to die from prostate cancer than our Caucasian counterparts. And so, of course, the obvious question is why? And so we'll talk a little bit about why. And some of it is, we'll talk about family history, first of all, and why that's high risk factor. So when you talk about familial risk, you're talking about a combination of environmental and genetic factors. So if you have, one or more family members with prostate cancer, and it's not clearly passed between generations, you may find that, your uncle had it, but, his son didn't have it, or somebody else didn't have it, but, you have at least one, then that probably is a combination of a genetic issue, but also more than likely there's some environmental stuff too, because we know that in the Asian population, sometimes they don't, especially like if in the, like say Japanese countries, for instance, they don't have prostate cancer, it's not as prevalent as here. And that likely has to do with the American diet, which is high in fat and just foods that don't bode well for cancers. So, and cigarette smoking, things of that ilk, those things can sometimes play poorly with genetic issues that may already predispose you to having a cancer. So if you have a brother with prostate cancer, that's more risky than even having your father with prostate cancer. Having multiple relatives with prostate cancer, more risky than having a single relative. Having multiple generations, of course, is more risky than having a single generation. But when you have multiple generations diagnosed at an early age, especially under age 55, that's certainly more risky, because if you're having prostate cancers diagnosed in such early age groups, those tend to be more aggressive. There's also genetic risk that's hereditary. And that means that in the germline, in the sperm, and in the egg, these are genetic mutations that get conferred throughout the body to all the cells. But in particular, there's some genetic mutations that are significant in terms of risk for aggressive prostate cancer. And there are many, but some of them that are more common and are studied in more detail are like the BRCA mutation. So you probably heard of these BRCA1 and 2 mutations as they relate to breast cancer. And they are related to breast cancer, but they're also related to other cancers as well. And prostate cancer is one of them, in which if you have a BRCA1 or 2 mutation, then your risk of having aggressive disease and dying from prostate cancer is significantly higher. That's why it's important to know what your family history of cancers are, because you may have a family member with breast cancer, or ovarian cancer, or colorectal cancer. And if you have those types of cancers, then your risk of harboring a prostate cancer that's aggressive goes up as well. So very important to know that. And men who have breast cancer prone families are in increased risk for having aggressive disease because of those BRCA mutations. So definitely important to know your family history regarding cancers. So that's one reason why family history is a high risk factor for prostate cancer in general. So now let's talk about African American race a little bit. Why is that a risk factor? Again, jumping right back to those high risk mutations, such as the BRCA mutations. Those high risk mutations occur at a higher frequency in African Americans. And again, these are just 2 mutations. There's so many. It seems like every month or so you're hearing about a different one that has this high risk associated with it when it comes to prostate cancer. So that's another reason why African Americans are at high risk. They have these aggressive mutations that confer this risk of prostate cancer. But even within the tumors themselves, there are genetic mutations that are just found in these 2 cancer cells themselves that make prostate cancer worse in African Americans. And so some of these mutations enable the cancer to grow and spread. They help the cancer to avoid dying when they're at the normal end of the cell cycle. So cells aren't designed to live forever, and they're supposed to die off over time at certain intervals. And so there are certain mutations that allow these prostate cancer cells to keep living beyond the time when they're supposed to have died. And those cells are more likely to be cancerous and to behave in an aggressive fashion. There are also mutations within these tumor cells that make them resistant to some treatments, such as radiation and chemotherapy. So that's another reason why African Americans tend to have more aggressive disease and are in the high risk category. And then even in patients who we've diagnosed prostate cancer as low grade, meaning that under the microscope, they have characteristics that make us think that they're not going to behave aggressively. Even in that setting, when they do genetic testing on those, they find some of these genes that are associated with aggressive behavior are even present in the low risk disease. And that's more often the case in African Americans. So that's why African Americans are in the high risk category. Beyond genetics though, there's the late diagnosis due to lack of screening, which puts us in the high risk group. And many times, I think Dr. Haley kind of touched on it too, there's limited access and utilization of healthcare. And some of that is socioeconomic. And that's kind of been highlighted, in this COVID pandemic, where people have to make a decision. I don't have much money. Do I put food on the table? Or do I go to the doctor to get screened for a cancer when I have no symptoms or I feel fine? You know, so those are very, very real issues. And that results in sometimes us not getting screened when we should be. Other things are social reasons, because there's a significant mistrust in the medical profession in the African American community, and that's existed for 100 years or more. And a lot of that goes back to how we've been mistreated by the medical establishment. People know about the Tuskegee experiment, but I'm here to tell you that's just the tip of the iceberg. There were so many malfeasances that were so much worse than the Tuskegee experiment that were committed against African American people. So there's this mistrust of the medical profession that prevents us from going to get screened when we ought to. But if you don't get screened, then you can't get detected early, and that results in a worse prognosis for us. Also, there's lack of clarity and uniformity regarding screening recommendations from different organizations. So the American Urological Association, the National Comprehensive Cancer Network, the United States Preventive Services Task Force, these are all organizations that have different screening recommendations. And usually most of the screening is done by your primary care doctors. And when your primary care doctors have to try to figure out which of these screening recommendations to go with, then they don't know exactly what to do. And many times they kind of regress to the mean, which means that they just screen everybody as if they're average risk. And that doesn't bode well for the high risk category. And we'll talk about that a little bit right now. So in 2012, the United States Preventive Services Task Force, that's the government convened task force to look at screening recommendations for different cancers. When they looked at prostate cancer, they looked at different literature that was available. And it wasn't very good literature, by the way. But anyway, they came to the conclusion that the harms of screening for prostate cancer outweighed any benefit. And they came to that conclusion in an erroneous fashion, but they basically attributed the side effects from treatment with being screened. So they basically said, well, you shouldn't get screened for prostate cancer because if you get screened for prostate cancer, then you might end up getting treated and the treatment has a side effect. Well, that doesn't really fly, because if you get screened for prostate cancer, you might have a prostate cancer that doesn't need to be treated. So you want to know if you have cancer. And so most prostate cancer specialists disagree with the task force recommendations and put up such a fuss, and there was such an outcry that in 2018, they revised their recommendations, and those recommendations were actually endorsed by the AUA. And basically what they said was that you should discuss the benefits of risk and screening with your patients, but only in men between age 55 and 69. But then in the high risk category, those people who are African American, like we now know, and also with family histories, it just says you should discuss the risk and benefits of screening. But it didn't, say they should be screened earlier or how they should be screened or anything. And because of that, people who actually take care of prostate cancer, like myself, like urologic oncologists or like radiation oncologists and medical oncologists, we actually take care of prostate cancer. The task force had none of us on those committees. We disagree with that totally, because we said because there's not an age specified when the high risk patient should be screened, then the primary care doctor is basically going to screen everybody starting at age 55. And then that means that the high risk groups might be screened when it's too late. So the opportunity to catch this disease early and take care of it might be lost if you screen everybody the same way. And so I'm going to tell you how you should be screened, all right? Because that's the most important thing about this talk, is that screening methods for prostate cancer, when and what you should do. So the screening methods for prostate cancer, the ones that you should do are the PSA. That's a prostate specific antigen. That's a blood test. So your doctor will just send you to the lab, they'll draw some blood, and there should be, the PSA should be at a certain level. The National Comprehensive Cancer Network says anything over 3 is abnormal. Traditionally, it's been 4, but most people have backed away from 4 a long time ago. Unfortunately, a lot of the primary care doctors don't know that. And so if your PSA is greater than 3, then that's not normal. The other part of screening is a digital rectal exam. And that's where the doctor puts a gloved finger in the rectum and feels the prostate. And what we're feeling for are hard spots or lumps on the prostate, because these hard areas shouldn't be there, and they're more likely to harbor prostate cancer, and they're also more likely to harbor aggressive cancer too. So the most effective screening method is the combination of the two. And that's important also because about 15% of men who have a normal PSA will have a prostate cancer. And if you just solely go on the PSA, then you're going to miss those. But you can pick up a lot of the patients who have a normal PSA, but also have an abnormal rectal exam by doing that DRE. And also you'll find sometimes that men can have a normal DRE, but have an abnormal PSA. So the combination of the two is the best way to go about screening men who are at high risk for prostate cancer. The National Comprehensive Cancer Network, which I mentioned before, they have guidelines. I like their guidelines because they're more comprehensive in terms of telling you kind of what to do and what if, and it's just more comprehensive overall. So for example, for the average risk men, they recommend screening between age 45 and 75. And they recommend doing the PSA and also doing a rectal exam as well. And then they tell you if your PSA is a certain number, then what you should do regarding that. But it also tells you for African-American men, you should begin starting to be screened at age 40, okay, instead of 45 or 55, age 40. And also men who are high risk because of family history. And in this particular guideline, they're outlining the BRCA1 and 2 mutations. And those men should be screened starting at age 40 as well. So this is the money slide. So this is what I want you to remember. The high-risk patients for prostate cancer are African-Americans, and they're men with a family history of prostate cancer, okay? And in those men, initial PSA testing should begin at age 40. That testing also should include a DRE as part of the screening, and also this should be done every year, okay? And then always there should be an informed and shared decision-making process between the patient and the doctor. But now that you know that you're at high risk, you can go to your doctor and say, hey, I'm 40 or older. I should be getting screened for prostate cancer. And you can tell them why. Because some of the doctors, like I said, they're going to say, hey, their guidelines say screen the average risk patient at 45 or 55. And you can say, hey, I'm not average risk. I'm high risk because I'm African-American and because I have a family history. Thank you for your time. I hope this was helpful, and I'm happy to take any questions.
It was very helpful. I mean, and I've had doctors that have said, no, we don't have to do that when it comes to that digital rectal exam. And I'm like, oh yeah, great. I'm glad we don't got to go. But now I understand it's not in my best interest to be so happy not to have the DRE.
Correct.
So I had no idea that it was that important. I really thought that the blood test would be really enough. So thank you. This has been really helpful. And I think we have some other questions. And someone asked, oh, they're 55 and they've never had a test before and wanted to know, and I believe you answered that, how to go about explaining to your doctor that they need to have it. And
Right. So now they know because they're African-American, they're in the high risk category, and the recommendations are to begin screening at age 40. So they're already late, but hey, better late than never. Get to it.
and PSA levels. And still, there are a lot of men concerned about having that DRE. What would you tell them?
Well, I don't really understand, the concern. It's a test that takes a few seconds to do, and it may save your life. And I get mine checked. In fact, I'll tell you, my primary care doctor, I tell him, I said, hey, it's time to check my prostate. He said, oh, you want me to feel your prostate? I said, no, let's back that up. I don't want to die of prostate cancer.
Okay.
That's why we're going to do this. So I don't understand that concern. It's something that's this benign, that quick, and it can save your life. I can't understand the hesitation.
And
Dr. Williams.
what's the outcome when people, the outcome when it's caught early and received proper treatment?
When it's caught early, there are so many different treatment options that are available for prostate cancer. I mean, there's radiation in one or two different forms. There's surgery. There's something called high intensity focused ultrasound. There's something called cryotherapy. There are lots of different options for treating prostate cancer when it's caught early, and they can be tailored to what's important to that particular man. And even when some prostate cancers are very low grade or low risk, and we don't think that they have any propensity to spread or to get worse at all, or even affect their lifespan, we don't do anything. We just follow their PSAs. We follow their rectal exams just to make sure that it doesn't get worse over time. But we don't do anything. We just do active surveillance.
Mhm. Oh, well, thank you very much. I really appreciate the presentation. And Jocelyn, do you think this is a good time for, does anyone else have any questions?
Well, Dr. Williams, someone someone asked if they could, if you could share your PowerPoint, but I know that's your product, so I don't know if that's something that you would want to do.
I don't mind the information, but I probably would not just share the whole PowerPoint.
Okay.
But I'm happy to see patients in my office. My number is 904-900-3581. And I love to sit and talk to people and explain things. And I love doing that. So,
And
someone asked, are primary doctors trained in administering the DRE?
I say that one more time.
Are primary care doctors trained in administering the DRE?
So they are trained in terms of how to do it. But the more you do, the more sensitive you are to abnormalities. And that's kind of where the urologists come in, because if your doctor feels something abnormal, the first thing you're going to do is send you to a urologist. And so many times I'll have patients come to see me for a different reason. I ask them about if they've been screened, et cetera, et cetera. They haven't, or they have a appointment with a doctor coming up. And I'll say, hey, you know what? Let me feel your prostate today, because if something's felt abnormal by your doctor, they're going to send you right back to me. So let's just go ahead and do it.
that makes perfect sense. And you have an Instagram as well, right, Doc?
Yes, sir. I think I sent that to you.
It's at Urology Consultants.
Yes, sir. At
So
Urology.
if anyone wants to reach you, they can get you and hit you up on Instagram at Urology Consultants.
Yes, sir.
Dr. Williams, good morning. This is James Kelly. I have a question for you.
Yes, sir.
So I once read that for African-American men, incorporating more fruit in our diet helps to prevent prostate cancer. My question to you, is that true, or is screening really the primary prevention for prostate cancer for African-American men?
Screening is really the primary thing that we should do, because like I mentioned before, because the American diet is what it is, then, whatever contribution that has toward you getting cancer has already occurred. It's already occurred. So at this point, what we want to do is to catch it early if it's present. And certainly anytime you eat better, that cannot hurt things. I mean, that's a good thing, but don't expect that eating well now is going to make cancer go away. It is not. It can impact your course of cancer positively, but it won't make it go away. So screening is the key.
Absolutely. Thank you for that comment.
In the follow-up to that question, by eating well, Doc, what do you mean by that?
So a diet that's low in fried foods and fatty foods, high in fruits and vegetables, those are the diets that should help the most. They did some tests about like selenium and vitamin E. They didn't find in most of the cases that they would prevent cancer, but they didn't find any evidence that it would make it worse for certain. So foods high in like tomato paste and tomatoes and things of that sort are found to be good things and not bad things when it comes to prostate cancer.
Thank you, Doc. Great. Our next presenter, I'm really excited. It's going to be Stuart Washington, is a licensed mental health counselor, and he's going to be sharing some information about our attitudes, and does our attitudes breed illness? And he's going to give us some really good information about that. And so thank you very much, Stuart. Mr. Washington.
Good morning. Can you hear me?
Good morning. Yes, sir.
I'm going to keep this conversation very basic, and it's because of my experiences with the Black men of all economic spheres over the years. I've been in this business for about 40 years before I retired. And my presentation is about my experiences with them in terms of attitude. The last doctor had a very good question. I mean, I think his statement was, I can't understand why something so simple can create, not doing something so simple can create such a problem. And it's all about attitude. Human beings, we live in a society where intelligence is kind of the rule of the world. And what I mean by that is we value intelligence more so than other components of our body. And attitude is really not an intelligent element of intelligence. It's an element of the will. And when you get into look up the definition of a will, you'll see what I mean. There's 50 million definitions of it. The specifically I'm talking about when we talk about the will is what we are born with that direct our physical and our non-physical, or if you will, spiritual body through this thing called life. A baby comes into the world with genetic predispositions. I used to work the OB ward rather, and if you a baby, I used to be fascinated that babies were coming into the world. They have eyes, arms, nose, mouth. They have all the elements, ears, those um, abilities to function in the world, and they can't use them. They can't walk. They can't talk. We have to learn all of those skills in order to navigate the world. But we come into the world with a set of predispositions. I think the doctors would call that genetics. I call it how you're wired, basically. And either you're wired for fight, flight, or fight. That is, you're going to be wired to be on the hyper side, or you're going to be wired to be on the laid back side, and somewhere in between. And all of that is based on how you gonna, it sets the tone for how you gonna navigate life. From that point on, well, actually from the point of inception, um, the body, the physical aspect of the body as it's being developed is also being, I guess you might call it programmed with a certain kind of a natural attachment to wherever that body comes from. And I'm trying to get around saying spiritual, but we are a human being. Our body comes into out of a place that we don't know about. I guess that's why a lot of people go to church. We're trying to, our creator creates us in a way that we come from somewhere that we can identify. So in life, in this physical form, and the physical form comes out of that creation, but it's never separated. We are undivided. We're indivisible. We are not just a physical body. We are a human body in a non-physical entity, and most of us refer to that as a spirit. So as we grow and develop, our intelligence help us to learn how to use those faculties that we're born with. And I kind of look at it like we're born with faculties. I'm talking about the five senses and including the skin, and what we call our sixth sense, because we don't know what to call it. And it's hard to get evidence on things we don't know what to call. So that's why I'm taking this approach to it. Um, we, we learn how to use those faculties to navigate the world. Some of those faculties involve a power. And one of those powers, the fact is called the will. And the will is that which directs us to do what we do. Um, if you notice, it personally, if someone walks up to you, you just meet them in the street and they walk up to you. If they're from a distance, it's okay. If they wave and it's okay. If they pass you, it's okay. But if they stop and come close to you, then you will begin to feel something. You don't know what that feeling is, but you begin to feel it because they have entered that space that comes with you. In other words, everybody is born with their own place in time and space. And if that place is approached or you feel threatened about it, by it, that's when your sense of that faculty of that will, if you want to call it, kicks in. And it directs you what to do. Either you're going to push them back, that's the fight part, or you're going to back up. That's the fight part. So having said that, in our minds as we grow up, we call our brain, in our brain, somewhere in our brain, something called the mind. And somewhere in that will, in that mind is something called the will. And somewhere in that will is something called the attitude. And the attitude is basically a feeling, how we feel about what we think before we do it. You don't think and do something. We just don't realize it, but we think first. That's the intelligence. Then we feel something, and then we do something. It's that feeling. You may want to call it spirit. Some people do. Energy, whatever. It has to be directed. And when it's directed, there's something called the will that does that. And we all have one, and none of us have the same one. They're all different. We are similar the way we look, but the way we behave and why we behave and our program structure is different. Our DNA structures are very different. So even identical twins have differences. We usually recognize that in terms of our fingerprints, our differences, or our eye print, or those kind of things. But all humans are different. We may think we're the same. And God knows in this society, we try to program everybody to be the same. But part of the problem is people resist. And that resistance comes because it does not fit into their will or into how they're wired, whether they are hyper or whether they're laid back or whatever. But what we do is form agreements in society because we are gregarious people. And in those agreements, we say we're going to do a certain thing. And then we get a little upset with people because everybody don't do it the same way. Everybody don't do what we say we want them to do. So what I'm getting at is in this faculty called the will, and I look at that as the power, there's something called the attitude or feeling. And that feeling is influenced by external factors, your DNA, how you think, how you develop ideas, your imagination, how you put ideas together, your decision to do something about it, the will, and the instruction to act are all experiences. All those things happen between your ears. They don't happen outside. As we are talking now, for instance, the director is directing, he's listening to me, he's trying to get a grip of what I'm saying, trying to follow me. He's thinking about what he has to do this afternoon. Our phenomenal mind does a lot of things at one time, but they do it in spirits, INSPERIENCE. That's an operational word, operationalized word. But there are experiences that distract us from those experiences called the outside world, people, places, things, circumstances, situations that we learn from the time our brains are developed in the womb, or our ears, our eyes, our nose, whatever is developed, by the time that body hits the world, it has already had a certain amount of learned internal and external experiences that predispose them to this world. We call them predispositions in the behavior field. Now, in the world, we learn, and that's where our intelligence come in, is how we're going to use these tools that we are given to navigate the world. And most of us learn them from our mom, our dad. My Boy Scout leader, for example, was my mentor and my second dad. I learned a lot of things from him. I was a mommy's boy, and I hung around my mama's skirt tail, so I got the cake spoon first, and I learned my eating habits from my mom and her attitude, or the minister's attitude, or whoever attitude came along with that. I learned those things, and I put them in my conscious bank called your memory. And if you think about what I'm saying as I go through this, because people too do get a little twisted trying to keep up with me when I do these things this way. If you think about, for instance, if I ask you a question, can you remember your first present? Immediately you go to 586 where it is, you get it, you get an image of it, that's your imagination working, and then you get a feeling about it. Because as with that experience, there was a feeling about it. Now you might have not have thought about it because you parked it somewhere and as I brought this subject up, you decided to do that. That's why the movie industry makes so much money taking you down memory lane, because those songs can take you to places where you can create those images that has an impact on your life, and you can remember how you felt about it. But that feeling is that attitude. Now, I gave you that little history for a reason, and because I don't have that much time to go into detail. And by the way, I do a group called, this is a support group, and it's online. And before it's over, if you ask me, I'll give you the number. Anybody can come on at any time, and we can go through this process that I'm talking about, because I'm just taking parts of it out to discuss this morning. But when we decide we're going to do something, all of those factors I just briefly went over kick in, because the mind is just that phenomenal. It can do 50 million things at one time. And well, what we do when we focus on something, we have to intellectually and consciously kind of receive that in our mind to focus on that which we're focusing on, and I call it a distraction. If someone blows a horn right now, you would turn for me instantly to look at that to see what that is, because you heard it, and then you come back to me. So when it comes to attitudes, we learn our habits, and that's how Black men, me being one, learn my habits from my minister, from my mom, primarily from my mom, because your first learning always comes from your parents, good, bad, or indifference. How you feel about things, what your choices are. And as we get older, we kind of augment them based on our experiences. But that underlying basic predisposition that I talked about earlier, and those early experiences, they call them precipitating factors, they influence our attitude. But that basic element of the attitude is learned from the family. If you learn to approach things by being angry or hyper, that's the flight syndrome, then that's how you're going to approach things, negative or positive. And it could be either. And the same thing, if you approach things from a laid back position or a non-negative position, then you make decisions based on that. Let me give an example of what I'm saying. My mom had a problem with depression. And as a Black man, I learned that how to solve problems through depression. And as I got older, I had to rewire myself. I had to relearn how to not be depressed. A lot of people don't like to talk about these subjects, but the idea of how I approached depression had to do with my attitude, how I felt about what I was talking about. My mom would say, hey, go to church, pray if you're depressed. My dad he just moved. So I learned how to deal with my dad's attitude by watching his behavior. Not what so much he would say, what he would do. And what I'm giving you is kind of an idea of how Black men in their family develop their attitude, develop from the people in your family and in your surrounding culture. That's including your ancestors, your grandmama, the things they say to you, the oral tradition that's passed down to you. The way I'm from a family of geechers, so I have a lot of superstition, like a lot of us do in our philosophy and how we develop our philosophy. But it all is based on that underlying attitude. Do we approach things by being positive, or do we approach things by being negative? Most Black men in this society approach things by being cautious. And they handle their depression by being angry. The group I run called Delineation.
Okay.
And it's a support group to teach the skills of how to deal with behavior, your personal behavior, and how to interact with others. And the number is a toll-free number. It's the first and third Saturday, 10 a.m. And the number is area code 904. I'm sorry, the area code is 515. It's a free conference call number. 515 7. Hold on a minute. Here it is. 515-604-9097. And the code is 261733#.
That code one more time.
2 261-733 pound.
And that's the first and third Saturday, what time?
10 a.m.
What's the name of the group again?
DELINEATION, delineation.
Okay.
Can you share the
Is it-
number again, please?
515 area code 515
604.
604 9097.
Thank you.
And then there's a code.
261-733 pound.
And Mr. Washington, why is it that so many African American men shy away from counseling and mental health therapy?
The same reason to answer the doctor's question why they won't go get a digital prostate cancer examination. Black men, there's two issues with black men that we grow up in. One is stigma, and the other is marginalization. Nobody pay black men, I'm talking about society, pay much attention to black men. So as a result, we develop a sort of idea of who we are and how we fit in the world. And that is not a positive, among most black men, attitude. And we've developed a sense of protection and a sense of manhood of things that we just will not do. And it's not too much different between an educated and an uneducated black man, because one of the problems with uneducated black men is because they don't read. Illiterate people, once they make their mind up about something, they don't change it. It's hard. It's very difficult to get them to change their opinion because they learn that to survive. For men who are born who are depressed, and what most black men, I said it earlier, what most black men do is when they're depressed, they act out. And that's a little different from Caucasian men. But the acting out part is for lack of not knowing what to do. But that defeats the whole purpose of image of a strong man. We're growing up to be strong. We're taught to be, especially by our moms, to be strong. And there's certain things you just don't do to show weakness. One of them is to have somebody to perform a digital test on you, and every black man on the phone can identify with that. So what we do is we have an attitude toward health, period. Is we don't look at health as a primary function of our life. Health is something we deal with, and that's an attitude, by the way, as it crops up. And that's the way we learn it, and that's the way it's imposed. And I have found out that I had a friend the other day who died from four different kinds of cancer, and he was a minister. And one of the reasons why is because he would not do yearly checkups. It was not a part of his image of who he is, which is a total distortion. I mean, your primary role in life is to take care of your body, then to take care of others. But black men are not, we're not taught that. So the reason being is we have an attitude. We have a resistant attitude. It's not necessarily anger, it's not necessarily depression, but it's just that it's not a priority until it comes up.
Interesting. That's fascinating. What is your recommendation on how to change those attitudes?
Is to teach them the infrastructure of the attitude. A lot of people don't understand. I tell people all the time, our brain, is on the top of our body, but we might as well be walking on it. Because most people don't understand how it works. They don't understand the will. They don't understand how anger develops. I call it, the infrastructure, and this men or women, it's all races, because we spend very little time in this society paying attention to the spiritual aspect of our being. There is a non-visible aspect of our physical being that functions where all of our physical elements and material elements and relationships come from. And we pay very little attention to it. Mm-hmm. We go to church and get tuned into it a little bit, but that's the religious part of spirituality. But there is a natural part of us. That's a spiritual element, unseen part of us that functions in our life, just like that we're not aware of, just like our intelligence and our physical faculties that I talked about earlier.
How are we on our time, Dr. Fitness?
We're at that time. And thank
Appreciate
you
it.
very much, Mr. Washington.
If he would talk about, just briefly, the social, the pressure, the pressures from society, from social and society on defining manhood, the impact of social and society concerns in the family of defining manhood.
The social, you talking about for black men, African American
Yes,
men,
for black men, African American men.
right?
It's not the man thing to do. So let's talk about what's that, those predefined.
Okay. By the time a young man, African American man, becomes 18, he already knows what society expects out of him. He already knows, and he already knows that's not good. Versus how he sees himself internally, spiritually. They have an idea of who they are and how they see themselves, but they've been marginalized or treated. That's what the big issue about now is defining black men by Eurocentric standards. And most black men know in their soul that that's not them. They just know it. And because it's not being enhanced, it's not being perpetrated, not intentional, I guess, by the family, but society has a set of rules that don't define black men by the way black men define themselves. And that's a conflict. So there's that's one reason why black men are angry, because they don't feel like they're recognized as how they see themselves as a person. And that's what creates the problem. That's why you have a lot of these guys, they get engaged because, and the parents can't reach them because they identify with each other's concept of who they are. That's a basic piece of it. And that's what people don't understand about why do young men, regardless of what your economic status is, why do they make friends who go break the law? It's because they identify with how they see themselves. That's what the conflict is.
Yeah,
Thank
And we
you.
don't teach that anymore.
that was a great.
I have one quick question as well. Alvis Kellum is on the stand. I was on mute. But quick question, how can we get churches, since we are using the church for the community, how can we get churches more involved to go into communities where you can target not just high crime areas, but working class areas to encourage black men to have a better attitude towards themselves? How will we go about doing that as a community? And where would you think we need to start to get that, to start that?
Well, the start that you can call me, I'll give you my number, my personal number. You can call me, and Roger and I are working on a project that we really need your concern in this project we're working on that goes right at that. The other piece is several years ago, Roger, I know you remember, we developed African men. We spent a summer, we went in retreat. We had ministers and professionals, and we developed the concept of fatherhood. To answer your question, the father doesn't have to be there to instill fatherhood upon the African American male. We just need to find a way to get those concepts in. So we would be glad to share that with you. If you give me a call, my number is 904-703. Want to do it again?
Yes, 904-703.
6532.
6532. And Washington is your last name, correct?
Yeah, first name Stewart.
Stuart Washington.
Okay.
Hey, thank you very much. We are running out of time there, Mr. Washington. And thank you very much for your questions. If anyone else has questions for Mr. Washington, definitely reach out to him directly. And his number is 904-703-6532. Time for a little bit of a break. We're going to have a little bit of a laugh. And so I'd like to introduce our comedian who's coming in. It's Jen Weeks, and she's the host of one of the hosts of Real Life Comedy. She's a comedian, actor, radio personality, and does Power Up with Pastor Terry. Jen Weeks, welcome.
Hi guys.
What's going on,
Hey
Jen?
fellas, how y'all doing?
Good morning. Good morning.
Thank you so much.
Yeah.
Thank you guys so much for having me. I appreciate it. Now, Pastor Williams, I'm gonna tell you first, when you asked me about this, I said, now they want a woman for the man up. I say, is he saying I look like a man? What's going on? I felt the way about that at first, Pastor.
Yes, you know, I love you. I love you. I'm so glad. I appreciate your comedy. You know, definitely not that. That's not an issue for you, honey.
I'm just kidding, but thank y'all so much for having me. Listen, laughter is a part of health too. It is good for you. I read that if you laugh between 10 and 15 minutes, you will burn 10 to 40 calories. So y'all gonna at least burn 10 calories, okay? So, all the stuff y'all talking about health-wise is so amazing. And I've been dealing with some health stuff too. Now, since I turned 40, when I tell you my body has changed, it is decided it's gonna take over and it's gonna be in charge. My bladder, I don't know about y'all, but the older I get, the younger my bladder gets. Is it just me? I'm 40, but my bladder is 5 years old. You hear me? I'm talking about if I drink more than that little 2 ounces of communion juice, it is a problem. I have to be a spokesperson for the opinions. Do you hear me? And not just my bladder, my stomach. Oh, this 40-year-old stomach is something. That 40, when I turn 40, my stomach say, this is not the Wendy's fofo stomach anymore. You can't go we don't do fast food no more. You're not going to Popeyes for a $5 box unless it got a salad in there. My stomach has taken over. Do you hear me? It has taken charge. It don't even do milk no more. I found this out yesterday. We don't do whole milk, 2% skim, almond, or soy. I'm around here eating Honey Nut Cheerios like they trail mix, just eating them dry. Can't even eat my cereal no more. This stomach do what it wants to do. I tell y'all, a 40-year-old stomach will embarrass you. My stomach treats me like an old school black mama. It will show out what I show out. Do you hear me? This stomach is no holds barred. Speaking of mamas, I don't know about how many of you are grandparents, but I have learned from watching my grandma, from watching my mom, that the way you parent and the way you grandparent is totally different. I don't know who my mama is. She has gone from Medea to Mary Poppins. Do you hear me? Honey, with us, she did not play, but with these grandkids, they get stuff I never knew about. They get stuff like choices. I didn't know what a choice was until I became a grown woman because we didn't get that. We were just told what to do. But not now, honey. My mama, I told her with every grandchild she lose a little bit more of her spine. She's so soft, she like toilet tissue at this point. She got 5 grandkids. She don't know what to do with herself. I said, ma'am, who are you and where's the prison warden that raised me? Because all this stuff that they get to do, we didn't have it. I'm a little jealous of my nieces and nephews. Now, since, this is 2020, a lot has happened. I'm working from home right now. And I've been working from home since March. I haven't been in the house a long time, and it's just me here. I didn't know I had to be around myself this much. I don't know that I like me as much as I thought I did. You hear me? I said, we need new friends, new experiences. Me and myself and I, we ain't got no new experiences, no new things to talk about. We know everything about each other. But my boss told me, she said, now you're going to be working from home. I want you to stay consistent. She said, whatever y'all did in the office, you do at home. So I'm still late to work at least twice a week, okay? Because I want to be consistent, okay? I said, I don't want to be insubordinate, so I'm going to still show up. I only got to walk 37 paces from my room to the office, but I still want to be consistent. I'm doing it for my boss. It ain't even for me. You know what I mean? Now, one of the things I am happy about is that this election is over. If for nothing else but for all these calls to stop. I was getting calls, text messages, and emails about voting, even after I had voted. They called me so much, I started wondering, did I owe them money? I'm like, who is this? Y'all calling me like a bill collector. Surely I owe y'all something. Every time they called, I pulled out my credit report. I'm like, I don't see y'all on here. Ain't nothing about voters' rights on my credit report. Honey, they was calling strong, yeah? They made sure we rocked the vote this year. I said, so if for nothing else than just for them to stop calling my phone ain't never rung so much. Since the election over, I don't even get text messages. I'm kind of sad it's over because now they don't text me. I be texting them now. They don't never respond no more. I don't know what's going on. Daylight savings time just happened, and usually I'm excited about daylight savings time in the fall because we fall back. We lose an hour. However, in 2020, I don't know that I'm excited about this. I said, I don't know that I want to be in 2020 no longer than I got to be. I was trying to push my time ahead an hour. I figured if I push the time ahead 2 hours every week, by the time we get to New Year's, I'll be on Australian time. Honey, I'm going to be in 2021, 16 hours ahead of y'all. I said, I don't know that I want to stand here no longer than I got to. 2020 has been rough. I said 2020 is gonna be a year we ain't gonna talk about too much in the future. We're gonna refer to it as the year after 2019, but we ain't gonna necessarily say it. I said after this year, I don't know that I want nothing 2020. I don't want 2020 vision. I don't want to watch the show 2020. I'm good. Don't even give me two $20 bills. You got to split it up and give me some 10s and 5s. I don't want to look at two 20s. It's been a long year. Now, one of the things they did this year was they deferred our student loans, which I thought was great, but that ends at the end of the year. And I just been wondering, when the end of the year come, who you gonna defer these loans back to? Because I don't want them. Listen, they deferred them and that was amazing. But listen, I didn't even get a full degree. Why I still gotta pay y'all? Listen, I have a 2-year degree. I have an AA in general studies. It's just general. Don't ask me nothing specific. You hear me? It's just general. So, and it took me 3.5 years to get that. Now, you really think you're gonna get your money back from me? I mean, I might give you some of it, but you're not getting all of it, sir. I'm like, this major was undecided. Surely you know these payments are too. You're not getting all this money. Matter of fact, let's do an even trade. You can have the degree back. I never even took it out the envelope that you gave it to me in. When you mailed it to me, it's in that same envelope. I never hung it on the wall. It's not in a plaque. It's not in a picture frame. You can have it back. It is in its original packaging. And we can do an even trade. Don't defer my loans. Dismiss them. Give them to somebody else because I don't want them. Please, I don't mind at all. I promise you, I do not mind. It's 2020. A lot has been going on. We're making masks. We're having to wear masks. But, you know, people are getting back around to getting outside and doing things like that. But I have noticed now, this has not changed for years. People are still living in their truth. I don't care what goes on in the world. I don't care how old we get, what happens. People gonna live in their truth. Now, it used to be the truth and a lie. Now it's the truth and your truth, which sometimes ends up being the lie. For instance, my older sister, she is 47 years old, and her truth is she lives with her roommate. That's her truth. Now, the truth is she still stay with our mama. I said, baby, you're not a roommate, you're a liability here. Roommates have things like keys. You got to wait for mama to come home. You just sit in the carport till she get back home, okay? Roommates pay bills. By definition, honey, you don't even qualify. You know, so when people find out that she really stay with our mama, she like to flip it and say, well, really, she's staying with me. I'm helping her out. I said, sugar, this the house we grew up in, okay? You sleeping on the same twin bed with My Little Pony sheets that you did growing up. Stop the lie, honey. You are not a roommate, okay? You're a burden. I have a best friend. We've been best friends for over 20 years. And her truth is that her husband works out of town. Again, that's her truth. The truth is her husband is in prison out of town. I said, honey, there's a difference. There is a difference. I said, listen, he put in work. That's how he ended up out of town. All right. She said it like he had options, like he drove out of town. No, ma'am, he was transported out of town for 3 to 5 years. Okay. This ain't nothing. He finna put on a resume. He is not getting a W-2 for this. And then we used to work together in the same building. So she would have pictures on her desk of him and her. And she'd tell our other coworkers, this was their company picnic. Girl, that was visitation. You go see them every Sunday. Cut it out. I said, a lie don't care who tell it, him. So everybody else around me is living in their truth. I felt like I needed a truth of my own to live in. So my truth is that, you know, I'm a little heavy set, you know. So my truth is that the excess meat on me is just baby fat. That's my truth. It's just baby fat. After you have kids, sometimes you put on a few pounds. So my truth is that this is just baby fat. Now, the truth is it's regular fat. I don't even have kids, y'all. Yeah, this is just regular USDA country Alabama backwood meat, honey. This is roll tide meat. That's what I tell her. And I tried to tell my doctor, I said, well, you know, everybody in my family is big. I'm the smallest one. When I go back home to Alabama, they call me a little bit. So, but he wasn't trying to hit it. But I said, that's my truth and I'm going to live in it. Now, I don't have kids, but I'm the type of person, I don't want to be the chief of the village, but I want to be part of the village and help with the kids. So I have some God kids and they are amazing. And something that I do with them is I try to, we'll talk and I'll do spelling words with them, vocabulary. So we did some vocabulary yesterday, but it didn't go as well as I thought it was. And I had to talk to my friend. I said, maybe homeschooling for you ain't your ministry. So I get my God babies on the phone and I said, all right, we're going to give you some words. So the first word I gave them was distill, and I make them use it in a sentence. So they're twins. So my first god baby, she said distill. She spelled it Distill. I said, okay, use it in a sentence. She said, my mama told my brother last night, you might be 18, but distill my house. I said, well, wait a minute, baby. That ain't really how you use that word, but now you used it good, but that's not how you use that word. So then I went to my next god baby. I said, all right, your word is window. So she said WINDOW, window. I said, all right, use it in a sentence. She said, God, mama, you keep telling us you coming to visit, but when though? I said, now you know what? So it's too much. I told my friend, I said, listen, homeschool ain't your ministry. This ain't working from you. And that told me that I need to go visit my kids. So I hope you guys have enjoyed. I'm going to visit my God kids because they waiting on me. Thank you guys so much. I hope you enjoyed and that you get some good
Jen
information.
Weeks.
And you have an amazing Saturday. Thank you so much.
God bless you.
Thank you, Jen Weeks.
Love you, Jen.
Thank you. I love you guys. Thank you so much.
Awesome, Jen Weeks.
Fantastic. I'd like to take a moment and just give our sponsors a shout out. Doc Turner, is there anything you want to say about our sponsors, AARP?
Yeah, we are very fortunate this year to partner with AARP Florida on this event, as well as Novo Nordisk for sponsoring our keynote speaker coming up, and the Northeast Florida Medical Society as well for their expert medical advisories that they always offer us. And actually the president, Dr. Barry Wright, is on the Zoom. Hello, Dr. Wright, how are you today?
I'm pretty well, thanks.
Thank you and the rest of the Medical Society for continuing to support us, as well as many thanks to the Florida Department of Health for continuing to support this event.
It's a great event. And yes, thank you very much to all of our sponsors. And now we get to move on to
Real quickly,
Oh, I'm
we
sorry.
are on Facebook Live. So if you have a friend or if you have a Facebook page, please share or Healthy Jacks Men. Share it. AARP is also sharing it on their page, and we want it to get out to as many people as possible. This is some great information this morning. Thank you.
It definitely is. And how would they go about sharing it on their Facebook page? Is there something they would?
There's just a share button on Facebook, or they can copy the link and share it on their main page.
Everyone got that too. You can either copy the link or just press the share button. So now we're moving on to financial preparedness. And this is a really great information. And it's really good to have a good financial footing, particularly when there's an emergency. We don't usually care when there's nothing to worry about and things are working well. But when we hit a pandemic and we're out of work and work hours change, then having your financial situation a lot more secure seems to be more relevant. And so this is a great time to have this discussion. And so Mariko Walker, hope I pronounced your first name right. Is it
Absolutely,
Mariko?
that was correct.
Okay. Mariko Walker is a financial advisor with Wealth Wave, and he's fully licensed in life, health, and annuity in the various series, 6, 63, 65. And he has 10 years of experience. And one of his greatest passions is to intentionally help other people grow and develop and become more efficient when it comes to their using their money. And so thank you very much, Mr. Walker, for being here. And if you can give us some wisdom, we'd really appreciate it.
Oh, no problem. Thank you so much for having me today. I'm about to share my screen. Let me know if you can see it.
Yes, I can see it.
Awesome. Good morning, everyone.
Good morning.
Thank you so much for having me. Dr. Fitness said, my name is Mariko Walker. I've been doing this close to over 10 years now. Started back in 2007. But I was started part-time doing this while I was working on cars. I used to work for Mercedes-Benz. I was a master certified technician. And I didn't realize how much of a passion this would become until I went through an economic crisis back in 2008. And I thought I was, doing decent, in my life, having a house, had my wife staying with me and, had a son, and we was, doing well. And unfortunately, I wasn't prepared for the pandemic, which was an economic crisis at the time. The housing market crashed, and I was working on cars, and I thought that was a good position. Everybody needed their cars worked on, and I was one of the ones who got let go. Very skilled in it, master certified, but at the same time, I had only 3 months saved, and that 3 months went down to $355. And I found myself having to make a decision on, do I pay the light bill or eat? Which one do we do? I was a point in my life when I got on my knees and I prayed, Proverbs 3:5, trust in the Lord all your heart, lean not to your own understanding, all your ways, acknowledge him, he'll direct your path. So grateful for fast forward, we're in a better situation. But I saw it as a calling because I was like, wow, I wasn't prepared at that moment. I wonder how many other people wasn't prepared as well. And we saw how it affected a lot of people's lives when they lost their houses, business going out, forcing people finances. So I was like, okay, let me take a step into doing this more seriously. And so grateful I've been able to get all of my license in finance, Series 6, Series 63, Series 65, a life, health, and annuity license with the state of Florida. And I own my own brokerage in Jacksonville. And I'm a fiduciary. So today is just some things that I believe that can help, but this is only scratching the surface on all the financial knowledge that we should know around money, especially when it comes to our community. So it's really about just being prepared for the unexpected. So one of the things that is really important to do before you even talk about, getting prepared is really sizing up your opponent. In any game that you play, football, basketball, baseball, any type of sport, you have to size up your opponent, just to be able to win. Well, the same thing is true when it comes to winning your financial independence as well, and building a strong budget, building a solid financial plan. And when you're drafting up this financial game plan, here's some things that you want to know that's a challenge facing you and your money. One of those things is not knowing how money works. We call that financial illiteracy. This problem affects over 70% of people in the population. Over 5 billion people don't know how money works. We're not taught in school how money works. Only 21 states out of 50 offer some type of course on finance, and it's at the basic level. Maybe how to write a check, or the different types of credit, but it's not on a more thorough basis. So one of the things that we want to do is teach people how money works. But you'll see consumer debt, poor saving habits, rising costs that's called inflation, and an economic crisis. Those are some of the things that we have to guard against if we're trying to have this ideal future of financial independence and being debt free. So you'll see right here, the number one economic crisis in the world is financial illiteracy. Only 30% of people in the world right now know how money works. We call financial literacy knowing how to earn, spend, save, manage. And then you also know how to invest your money where your dollar is earning interest or is making a dollar earned back to you. That's financial literacy. Right now, where we are in America, 44% of Americans don't have enough cash to cover a $400 emergency. And this was before the coronavirus. It was before the pandemic. 43% of people wasn't making their student loan payments. We heard Jen saying most people don't want to pay their student loan. But unfortunately, that student loan is earning interest every single day. So if you don't make that payment on that student loan, you can't bankrupt it. So you got to pay it at some point. It only get worse and worse if you don't pay it. 38% of people right now have a credit card debt averaging somewhere around $9,333. And I've seen bigger numbers than that. Right now, the unfortunate thing, 33% of Americans right now are saving for retirement. Right now, there used to be a way where people used to go and work for a job, they'll get a pension, and they'll retire getting a guaranteed income. And for you who have one, God bless you. But there's a lot of people right now that don't have a pension. So they have to understand how money works, because it's shifted to you have to put your money in a defined contribution plan called a 401k, a 403b, or an IRA. So it's very important that you know how to invest it, how to grow it with protect it at the same time. And then you have Social Security. My hope is that it continue to be here, but the way it's going right now, it's going to be reduced or gone in the near future, 2034. So right now, unfortunately, there are people who are passed away from the pandemic. As you heard from Dr. Haley earlier today, that the case continued to rise. But the one thing that I can say that the pandemic have done, it have started people to get serious about their money, get serious about saving, not spending as much, not eating out as much, getting an understanding of their finance, understanding the importance of life insurance, understand the importance of having an estate plan like a will or a trust, healthcare surrogate, power of attorney. I can say that the pandemic have done it. So it's one of the things that unfortunately people have passed. Unfortunately, people are getting unhealthy. And also, but at the same time, people have become more serious when it comes to their money. So what I'm gonna talk about today is how to be financially prepared for the unexpected. One of the things you have to do is recalibrate. Another thing is anticipate, identifying the budgeting style of your choice, and then course correct. So recalibrating your life. When I had that situation occur to me, I got let go from my job. I realized that I had made a mistake. I went on my porch, I looked in the sky, and I said, I'd never let this happen again. So when you are recalibrating, like taking your car in to get this four-wheel alignment, well, you have to do that every single week. You have to recalibrate and say, okay, what is coming in? What is going out? And you also got to identify what are some ways you can save. I'm going to talk about some ways you can identify in your budget, in your financial plan, ways you can find money you can save. It's important that you have a goal. What the goal do is sets the course of where your direction. Could be when you're going into the mall and you have a goal to pay your debts off, or you have a goal to get your emergency to 10,000, 20,000 or more, or you have a goal to retire in the next 5 years. You're walking in that mall and you're window shopping, you see something that you want, or you're on Amazon shopping for something or just browsing around. And you say, you know what? Ooh, that'll look good on me. But then because you have a goal, a direction, you will say, you know what? What's more important right now? Hitting my goal or the feeling that I'll get when I purchase that particular item? It's really important that you have a goal. Another thing you got to have is a strategy, a system. See, you don't focus on your goal. Once you set it, you focus on your system, which is your process. When you get paid, what is your mindset? Do I pay myself first or do I pay myself last? Mindset. What is your system when you get in your money? Oh man, do I go out to eat when I get paid? You know what? Let's go purchase something using my credit card. Like, you got to decide on your system because that determines your future. See, when you're taking personal inventory, it's about managing your strategy, your story, and your state. See, your strategy is your plan, your spending plan. You know what? I got my budget, everything is itemized, and my money is going everywhere it needs to go. That's my strategy. But you also got to manage your stories too as well, because I wasn't raised growing up learning about money. It wasn't until that economic crisis happened where I got more serious with my money and I became a student. I started reading, I started attending things, I started paying attention because my goal was for that never to happen to me and my family again. Your story is, what are you telling yourself? Oh man, I'm always broke. Man, you know what? That's what it always has been. So if you are telling yourself that you can't save, oh man, I don't have any money, I'm broke. If you're saying that to yourself, it will always be the outcome every single time money comes in, because it'll create the situation in your life. And state is how you feel. When you spend your money, how do you feel whenever you're doing something? So it's managing those things, because it's 85% of your finance that is in internal. The way you think, the way you feel, the way you talk to yourself, that's 85% of your results. Only 15% of your result is the actual application of your knowledge on something. So it's internal, and also the people you associate with as well. So here's some things you can take inventory on. W-4 allowance. There's people who fear getting audited, fear paying taxes. See, it's about, at the end of the year, breaking even. See, most people want this big income tax check. They'll put so much money in taxes sending to get a big refund check. But if you do it right, it's about breaking even, and during the year, you are managing your money. You're investing your money, getting an interest on your money. You are making sure that it's invested in the right way. See, when you get your money back at the end of the year, it comes back with no interest. See, when you send your employees out, you want to come back with some more employees to work for you. See, you'll see light bills. Some people leave their lights on all day, not in the room, lights are on. Things are plugged in all day. I remember in 2008 when it happened to me, I was turning off water heater, making sure I was conserving energy because I was trying to save money. See, at that moment, it was important to me. But when things became better, the key thing was for me is taking those same behaviors that I have learned in that economic crisis and applying it when I had better money. It's the reason why me and my family have been in a better situation now, is because since that time happened, we made really good choices as it related to money. See, most people say, Mariko, is it that serious? Turning off my water heater, turning off my light, unplugging things. You know what? JEA ain't mad at you. They saying, keep that light on, baby. They saying, you know what? It doesn't matter. Keep that TV on at nighttime. They don't care. They just saying, I want to just keep collecting the money. And what happened to your bank account, it goes down. Groceries, eating everything that's in your refrigerator. Eating things in your pantry, not just throwing things in the trash, because when you throw things away, that's money going down the drain. That's money going in the trash. That's time you worked, and now you're saying, what I did, it didn't matter. Fast food, restaurant. The great thing about the pandemic, we're not eating out as much. We should have more money saved. We should be investing more. And you see right here, shopping around for another insurance. Sometimes people are loyal to their insurance company. I have seen my insurance payment drop because people wasn't driving as much. And I said, okay, they are thinking about their customers, so I can stay with them. It was higher and then it dropped. But if it was higher and then dropped, I'm looking for competitive companies that are good. You know, do I really need cable? You know, for me at a point in my life, you know, I didn't have cable and I don't have it now. I read and study more because I realize that the more I know, the more I can help people. You know, at the end of the day, it is not growing my value, my income when I'm watching a lot of TV. So right here, late fees. Late fees are one of those things that if you're not managing your money, you'll see those overdraft fees. So that's a way that you can save gas, not frequently going to the store multiple times throughout, kind of planning your week so you can reduce that. You know, do you really need the updated phone service? You know, rising deductible costs. You know, sometimes it's good to start some type of business where you can get a deduction from the thing that you normally spend, like on phone service, on internet, or, you know, things on light or travel. You can get those things back at the end of the year. Plan, you know, inventory is identifying what debt company that will work with you at this moment. You know, some debt companies that will work with you that may stop the interest, they may stop the payment, but you just got to be careful that at the end, when it come back, you have to pay that big amount. So you want to say, do I really want to stop this payment right now? Because will you have the money when it comes back and having to pay the full amount? You know, will you have the money to do that? So you just got to be conscious of that. You know, taking inventory of your faith, you know, having faith in this time, believing that things will get better, assessing your skills, saying that, you know what, I'm getting paid at this job. You know, can my skills earn me more money at another company? Because you're trying to find ways to save, you're finding ways to pay your debts off. You know, assessing your knowledge is something that I did. I raised my knowledge level, and I'm gonna kind of talk about some things, how to do that. Subscription service, things that you may not need. You know, the great thing about now, we are, you know, they have made it easy to have these streaming service, but at the same time, it adds up when you put it on paper. You know, looking at your investment accounts and also identifying the right life insurance, because at the end of the day, like a lot of people have said, you know, the pandemic is here. We want to make sure that we protect our income. Those things are very important. Anticipation is about expecting the best, but also planning for the worst. When it comes to me anticipating, if I get fired or let go, what is my next move? Do I have a 3 to 6 months set aside emergency? I made sure I had at least 2 years saving because I remember how that felt, and I said, you know what, this don't feel good. So I consciously made sure I had more than a year saved. But sometimes, you know, people talk about get to that $1,000 milestone, which is important, but you want to continue to build on that to that 3, 6 months, year or more emergency. And then you'll see, what if your business closed down? What is your next move? You're anticipating the best, thinking about your service, thing that you can do, what you can bring to your company, how you can get to a better position. But what if it closed? Then what? You know, what if a family member have need? What are you gonna do? You know, do you have the money in your saving to help a family member? What if you do get an illness? What if a death do occur? Illness and your job don't provide some type of, you know, disability and no money is coming in. Do you have the proper saving? Do you got a proper disability? Do you have the proper life insurance? Because when you pass away, there's no money coming in. So I got to ensure that money still comes in, because you can't replace your life, but you can replace that income. And then you'll see right here, what if a repair come up, like a major tire, battery, engine, something that can occur in your house, AC, roof. Like these type of things I anticipate, but I'm also expecting the best. I'm looking toward the future, but I'm planning these days. Like, okay, these are the things I need to make sure. One of the things that I've seen the breakdown in somebody's financial plan is in the budgeting. The budgeting is really is the breakdown because a person don't see it. In 1952, there was a person named Florence Chatwit. Florence Chatwit swung in 1952 26 miles from Catalina Island to the California coastline. And it was 26 miles. And so as she went out, she had her mom and dad on the one side and she had a team on the other side, and they was going with her. 15 hours into her swim, a fall came and she couldn't see where she was going. Because she couldn't see where she was going, she went one more hour, but she was telling her mom, I don't think I can do it. She started doubting her ability. So eventually they took her out of the water. And as soon as she sat in that boat, the fog cleared up. And she realized she was just only 1 mile away from her destination.
Oh, wow, that's a great example of really knowing what you need to be doing where it comes to your finances.
Absolutely.
Yeah, Mariko, Mr. Walker, where can people reach you if they have more personal financial questions that they'd like to ask? Can you type it in the room?
Yeah, actually, I'm
your
gonna have
contact
that at the
information?
end. I'm gonna have everything that they can screen capture. I make sure I put it in there too as well. I can definitely go to it, making sure that we have that information. This is my information right here.
Okay, great. So if you have any financial questions, you definitely need to reach out to Mr. Walker. He is the man to help you with your financial planning. And here's his contact information. Please screenshot the screen and reach out to him. And he's on everything: Facebook, Twitter, LinkedIn, Instagram. That's what I'm talking about. So you will easily be able to reach him. And I know a lot of us has a lot of different questions that we need when it comes to investing and making sure that we're financially secure. So a good place to go is to make an appointment with Mr. Walker and start that process if you haven't already.
And one of the things that somebody can do is they can request, once they friend request me on Facebook, I will add them into my Facebook How Money Works Learning Center. It's called How Money Works for Beginners.
Oh, that's great.
One of the things that we give is a book called How Money Works. Stop being a sucker.
Okay.
Unfortunately, we are taking advantage of when we don't know how money works. So I'll give this book away, which have sold close to 500,000 copies, and it was just launched in December 2019.
Wow.
It was a really, really good book. And also I'm doing a How Money Works masterclass on this coming up 16th at 7 p.m. It's going to be done on Zoom. So if somebody reach out to me, I will make sure that they get a part of that free How Money Works masterclass. I'll be doing masterclass part 1 on this coming up Monday. And then the following Monday, I'll be doing part 2 of the How Money Works masterclass, going over all those concepts: compound interest, rule of 72, life insurance, budgeting,
everything. Yeah.
So
So once they reach you on Instagram, they'll be able to get all that information, right?
Well, primarily Facebook. Mostly I am on Instagram. I do respond back to that, but I would say most of my information will be on Facebook or LinkedIn.
Okay, great. So thank you again. We really appreciate you coming on and presenting today. It was very valuable information, and you're talking about stuff that's really happening in the now. So I appreciate that.
Oh, no problem.
It's time for us to move to our keynote speaker for today. Two-time Super Bowl winning Mr. Otis Anderson. And I'm really excited that he's going to be here. He's going to tell you about his story and explain some of the things that have happened since he has left professional football. Hey, welcome, Mr. Anderson. How are you doing today, sir?
Good morning, Max. How you guys doing? And great information. I just was listening on a few minutes ago. He's so correct about your finance and just really trying to get a grasp on that. But good information. Ladies and gentlemen, thank you for being a part of today's activity. Um, as Max said, I was two-time Super Bowl champion out of the greatest school in the state of Florida, University of Miami. Even though there's someone on this line who might think differently, but that's okay. And you know what? I started my professional career off in St. Louis in 1979. I was a first-round draft pick. Um, Played 7 years for the Cardinals. During that time, I was voted Rookie of the Year, league most valuable player in my first few years into the league. And then later on in '86, I was traded to the New York Giants, where we went on and won our first Super Bowl against Denver in California. After that, I was not really playing a whole lot. And then later on, I got to play again in '89 and was voted Comeback Player of the Year, went over 10,000 yards in my career at that particular time. And we played in Super Bowl 25 in Tampa, Florida, where we beat Buffalo Bills, and I was voted Most Valuable Player. So I give you all that to say I was this well-kept athlete who always ate well, who kept himself in the best shape. And now I'm at the end part of my career. I played 14 years. '93, I retired. And I retired weighing about 235, 240, maintained my weight for a very long time. I'll say about around age 45, I started noticing significant changes in my body. One is that I started noticing that I started having kind of like weak vision. I started noticing that as I would apply lotion to my body, and we know as African American, you got to get that ash off them legs, got to get that ash off them arms. You can't walk around with an ashy body. And I noticed as much as lotion I was putting on, I was still noticing I would still be ashy. My friends would come up and say, "Man, I can write my name on the back of your leg," you know. And I'm going like, "Yo, man, I got lotion down." So you start looking at things like that. Now I didn't know that I was going toward diabetes. Now I heard about diabetes, but it was called sugar the way I grew up in my neighborhood. So diabetes didn't quite focus in my head at that particular time. Eh, So around about 50, I started having more relationship with my doctor. Prior to that, you know, I had the Giants organization. They kept all of us fit. We can always go see those guys. But I was no longer working for the Giants. I had to fend for myself. I had some jobs here and there where I had employment and had insurance, but not quite, you know, paying attention to it. So when I saw my doctor around 50, and he said, "Hey man, you need to really start taking control of your sugar. And also you need to start losing weight." Okay. And he said you were pre-diabetic. Now, ladies and gentlemen, when you hear the word pre, that means you don't quite have it, but could have it or could get it. So I'm like, okay, all right, you know, for the next 3 to 4 years, I went from 230, 245 when I retired to at around 50, I was about 295. When I turned about 55, I was 315. And now this is when the situation got pretty complicated. I noticed more and more about my vision. I noticed more and more about how my skin was reacting to not having, after putting lotion on. And I just started noticing how big I was. Now, ladies and gentlemen, if you have true friends, tell your friends when you see they're gaining weight and they're getting big, okay? So I had conversation with a lot of my friends, and a lot of them told me, "Well, I thought you knew you was getting fat, or I thought you knew you was getting big." Well, no, you don't. You're in denial because you don't think that the weight you're gaining is that big of a deal until you realize your numbers are high, your cholesterol is high, your pressure is high, your sugar is high. So all those things starting to happen to me. Now, round about, I would say 60, because I'm 63, I noticed I was about like I said, about 320. And that's when I really had a serious conversation with my doctor. He said, "You know what, man? You don't get it. So I'm about to put you on medication." And I'm like, "Well, do I have to take insulin or do I?" He said, "Well, it depends on you. Right now, I'm just gonna give you pills to take, and you either lose weight or you're gonna be on insulin. Or you're gonna have your pressure so bad that you may end up with a stroke. So all those things start scaring me. So I went back and did some research. So I talked to my sister, my siblings to see what was going on with them. And my sister come to tell me that she didn't know she was diabetic. My other sister said she didn't know she was diabetic. So I'm going like, whoa, how long have y'all knew about this? They knew 3 or 4 years before I even recognized I had it. So it was genetics, but yet we had to do something about it. I formed a relationship with Novo Nordisk about 2 years ago. And the information I got from Novo Nordisk and dealing with my doctors, because one thing I found out is that when you have a relationship with your doctor, good things can happen. And they really can save your life. They really can make a difference in your life. And the conversation I had with my doctor changed my whole way of doing things. So I went on this diet. I went on this diet to lose weight. So I stopped eating as much food as I normally eat. For instance, I will go to Popeyes. Everybody know about Popeyes. I'll get a 5-piece. I eat a 5-piece. I get about 3 biscuits. I get a thing of fries, and I'm gonna help myself out. I'm gonna get a diet. So I figure I'm doing all right. But that's how I was eating when I was about 315, 320. But I'm a realist. I know good and well I'm not gonna get rid of and stop eating the good food that I grew up on. You know, the mac and cheese, the baked beans, the coleslaw, the fried chicken. So what I realized what I had to do for me was to cut back. I learned how to eat in portions because again, I'm a realist. I'm not going to tell people, "Hey, don't eat this, don't eat that." That's not being real. So I learned to eat in portions. By me eating in portion, ladies and gentlemen, I went from 320 to where I am now currently at age 63. I am right now about 270, between 270 and 275. I went from size 4X clothing 4X clothing to 2X to XL. I went from size 52 waistline to down to 44, 42. So my message is simple as this. Get a relationship with your doctor. Friends, talk to your friends. Let your friends know when you see they're gaining unnecessary weight. Let your friend know when you see how big they are getting. Spouses, talk to your husband or talk to your wife. It's life-saving information. Novo Nordisk has been great to me. And one thing they taught me about diabetes is that it never takes a day off. It's a constant battle that you got to have with yourself and with this disease. But it's a disease that can be controlled. And I've been able to control my disease by cutting back, taking my medication, exercising. If you can see right now behind me, I'm actually on the golf course. So that goes to tell you, I'm getting my walking in, I'm getting my work in. So my message again, ladies and gentlemen, have a conversation with your doctors, have a conversation with your spouse, and learn to eat portion control and exercise, and get as much information you can about diabetes. And I tell you what, a great place, Novo Nordisk. I'm a patient ambassador for them. I go
Uh-huh.
around the country representing them, speaking about my situation and how I'm living every day with diabetes. That's my
Hey,
message.
hey, thank you very much, Mr. Anderson, for being here and sharing this message. So you did a great job explaining, so much about diabetes. Is there one takeaway from the experience that you think we really need to know? Is there like one thing that we really need to be aware of when it comes to diabetes, prevention wise, or?
Well, I think one is you got to watch what you're eating. I think that has a lot to do with it, and weight gaining. I mean, again, you don't have to be obese to have diabetes. That my sister's not obese, neither one of them. They're small. Sometimes it's just genetics. Genetics. What should I say? Genetics are,
Mhm.
and you just don't know. But but my advice, the only thing I can say, Max, basically is learn to have a relationship with your doctor. We as men refuse to go to the doctor. That's why women outlive us because they go to doctors all the time.
Mhm.
We're afraid of what we may find out. I'm saying, if anything I can say is please go have a conversation with your doctor. That can change your life, and watch how much you're eating and what you're eating.
Great advice. Hey, thank you very much for joining us, and have a great day out there on the golf course.
Thank you, Mr. Anderson.
Well,
Wonderful.
I appreciate you guys. You guys doing a great job with your message, and all the speakers. thank you so very much for the message you have been giving, and those who will be coming up to giving more. This is what we need right now during this pandemic time. This is what we need. We need an uplift, and this is what you guys are doing, Max, and all the crew on here. And
Oh man, we
and
thank you.
you know, we
Yeah,
appreciate you guys. We appreciate
thank
you
you
guys a
very
lot.
much.
So have a good one.
Get them straight.
Yeah.
Oh yeah.
Go Giants.
Thank
I
you.
heard that. Yeah. You know, there's another really big issue that's happening right now in the community, and it has to do with our relationship with the police. We've all seen the George Floyd video, and we all have known what's been going on with our relationship with the police forever. And so we the organizers thought this would be a really good time to invite a police officer on to give his perspective about how to enhance the relationship between the community and the police. And so Officer Richard Henley is a 23-year veteran of the city of Jacksonville, and he's at the Sheriff's Department, and he's going to be giving us a little information about how to enhance the community relationship with the police. Miss Officer Henley.
Hey,
There you go.
you got me. I thank you so much, Dr. Fitness. I thank you, Ms. Turner, because this is a big issue that's going on throughout not only Jacksonville, but our nation. And I do see it changing. Some of it's going to change due to the rhetoric that's been shown from higher up is now going to decrease. So it is an honor to be here and to speak in reference of these issues. We was running a little bit behind time, but there was something that I had set up when I was downtown, and I wanted to speak about the spot that I was actually in. I was at Hogan and Duval, and that historic spot marks the spot of what is now going to be the James Weldon Johnson's park, but it had another historical reasoning that I seen behind it. And on August 27th, 1960, there was something known as Axe Handle Sunday. And with this issue, it took place on a Saturday, but with this issue, there was a man that Jacksonville has a lot of respect for, and me as a sergeant here with Jacksonville Sheriff Office, I have a lot of respect for this young man. But on Saturday of August 27, 1960, a group of minorities decided to have a sit-in where it was all in reference of fair justice. We know what Martin Luther King has spoken in the past, that injustice anywhere is a threat to justice everywhere. And in this, these brave young Black colored men that I know that we, and in my generation, were not able to see all of them, but we owe so much gratitude and respect for these young men that actually took place in Jacksonville. And in this sit-in, it was never about a hot dog or a Coke. It was just about justice, being treated fairly. And so for Axe Handle Sunday, many mob groups, people that had a disparity against colored people, Black people, they decided that because we wanted this justice, that they was going to proclaim justice in their own way. And by doing so, they decided to get the axe handles and make it known that they're going to show the African American community how to behave. Now, granted, we know that these things have taken place all over the United States, especially during the time of when we're talking about the boycott, when we're talking about things that's happening in Alabama, things that have happening in Mississippi. But this actually happened home, and I was very eager to learn about this. So in this Axe Handle Saturday that that took place, the police was around. And the thing that caught my attention is that not only were the police around, they were within the vicinity of these actions that was taking place against Black men or colored people. And nothing was not done about it. Colored men, Black men were at the mercies of mob groups, people that displayed hatred. And in that, colored men, Black men were hit, beat. And the thing that caught me was there was a guy that was there. And since the name of this conference that we're doing is Man Up, there was a young Black male that was in attendance. He was working at what used to be the woodwork down at him and Plaza Park across the street. And when he came out, he began to witness what was going on. I call him a young man. We all know he's older and very respectful. His name was Nathaniel Glover, the former sheriff of the Jacksonville Sheriff Office. A man who I respect dearly, who's very renowned, in my opinion and many other opinions. And as he came out and he seen this action, he said he was very afraid. He ran towards a police officer. And that police officer told him the best thing he can do is run. So he ran home, all the way home. Granted, God spared him where he did not have to suffer any attacks by people of racism or racist or hatred that may be in their heart. But his fear drove him to another level. And we're talking about how to respond to the police. You have a young Black man who thought the police was there to help, and the police was not. That Black male changed history. Instead of gaining hatred for the police department and further, instead of gaining hatred for Caucasian people, he gained resilience. He gained another thing of fighting back. He decided to make a change to the problem. We know that many times in leadership, we ask our team, if you bring a solution, if you bring a problem, at least bring a solution. He brought a solution where he decided to join the Jacksonville Sheriff Office. And in 1995, he was the first elected African-American sheriff of the Jacksonville Sheriff Office. And if I'm not mistaken, I think he was the first African-American sheriff in the state of Florida. But I say this to say that the responding to the police that we know is a major issue. And there are two sides to these stories. You have the police side, you have the citizen side. How do we build relationship? How do we build this trust? Well, one thing that Nat Glover did, one of the first things that he removed upon coming sheriff was he removed what we call the LV&R, the lateral neck backward restraint, the LVR. And it was what the outside world may see as a chokehold. He removed that early in the late 90s upon him coming sheriff. He was already looking far down the vision of life to know things that African-American men and other law-abiding citizens, and even some citizens that may not be law-abiding at that time, he knew that he did not desire for them to suffer any type of injury that was not worth the cause. So he changed history as being the African American sheriff in the Jacksonville Sheriff Office, and also changed history with the way that tactics were used. Over 20 years later, we see what he banned back then. We see that it came to light here. Not here in Jacksonville, but in Minnesota. And it caused a riot everywhere. That riot was a riot that I will say that was needed. It's not popular among police officers to say that riot was needed, because I would not say that the violence was needed. I do not condone the type of violence, but I do believe in what was said by Elijah Cummings, Lewis, Congressman Lewis, is that good trouble is worth it. If you're going to be in trouble, be in good trouble. So when we're talking about protests, and actually I probably should use that word instead of rioting, but legal protests to speak out, protests to come against what is wrong and to let our voices be heard, because that is important. Now, the looting is not exceptional at all. That is something that is definitely condoned. However, we've come to a time where we responding to actions of the police can be done safely, and it can be done legally. So my job as a supervisor with the Jacksonville Sheriff Office is to ensure that you have the knowledge of how to respond to police. One of the biggest things that I come from the old school, and I came up in a neighborhood that drugs was very prominent at the time. You seen them as you walk to school. You seen young men of color for the most part, out selling these illegal substance to the community. But there was one thing that I seen. I seen the respect that some of those young men had. I condone this type of behavior as far as selling any type of narcotics, any type of drugs. So I don't want this to be misrepresented. But they had respect for Miss Johnson's yard. They had respect for Mr. and Mrs. Walker. That they knew what they were doing were wrong, but they still had respect. And that respect, Dr. Fitness and many other people that may be listening, is beginning to decline. It's beginning to wither away. One of them is that we are in a society where we are not respecting our own. We don't respect our neighbors, even if they're the same color. Someone says something to a kid, instead of saying thank you, because my child knew that that was wrong, they are ready to fight. So the first thing that we have to do is learn how to come together as a nation, as a people, as a community. We have to deal with what's in the inside of us. And as we deal within the inside of us, then we'll learn how to deal with adversities that come our way in legal standards, in legal ways. How do we do that? When we have an encounter with the police are equipped with, all police officers from the rank of sergeant below, they're equipped with body cameras when they're in a full uniform, such as body cams such as this. This footage must be rolling at the time of a call, or when they have a situation or incident that they're making contact with a citizen. And this is another form of gaining trust. Now, granted, it is technology, and we know that with technology, not everything is 100%, but it's a start. So when you're dealing with the community, and when you're dealing with things that's going on in your community, and you call for police services, or you're stopped by the police should be the one that actually have the first level of respect. We're all in a neighborhood where respect earns respect. But us as Americans, us as what I would say men up, that we have to man up. And we have to teach our young sons how to man up. When adversity comes, how to react and how to respond. And some of those responses may be a response where at this time, I have to stay professional.
Mhm.
I'm not talking about the police. I'm talking about you. The police should be respectful. We have an obligation. We are under oath. We are here to protect. We are here to serve. One of my greatest pleasures over 23 years, Nathaniel Glover deposited a lot of positive attributes that I can definitely say in my life. And it paid off. Never having to have a complaint in reference of the way I treat citizens. Only complaint I ever had, and it's not a complaint, it's just something not showing up for court at a specific time. Only thing in my file. Because I know that we have to respect and gain the trust of the community for our jobs to be successful. So when responding, I will ask that that police officer may not display respect, but you can. We can. Outside this uniform, I'm no different than you. I represent every color. However, I am a minority. I am a Black man. I have been pulled over by the police. And the respect level that comes with that will take you a long ways. Not with everyone, because the police also must have some type of dignity inside of their hearts.
Mhm.
And with hiring, every now and then, some bad ones slip through. And when they are, you need to know what to do about them. Know how to file a complaint with internal affairs. Know how to call a supervisor. So as I get ready to wrap up, I want to be available that I can answer any questions. Sorry, I was running behind time. There was some things that we had set up that I wanted to actually show what
Mhm.
to do with stop by the police. But because it was running behind time, some things had to, um, some other decisions had to be made. Other people had to leave. But
That's- I'm
I
sorry.
just want to say thank you. Yes, sir.
No, thank you. And there are people that have a few quick questions if you're okay with just taking a few quick ones.
Yes, sir, I am.
Uh, Someone asked, how should we, what is the police department doing to deal with the vigilantes that are inside the police department? Is there something that they're actively doing at this point?
Good question. As you are seen by the current sheriff, Sheriff Williams, Mike Williams, if you've noticed that the arrest of police officers, I'm not happy to say this, but I am happy, is that we are being held to a standard, and police officers here in Jacksonville are facing consequences. We've had 10 arrests just this year. I'm sorry, in reference to the last couple of months, that of officers, and all of them are not officers. Some of them are civilian staff that's with the Jacksonville Sheriff Office. And however, we have those, and the sheriff is very strong with police officers being up on the oath and taking this job seriously, and not invading anyone civil rights. And if you're caught doing such violence or things that's outside of the training of the Jacksonville Sheriff Office, you're being held accountable. And some of them are being incarcerated, which we just had one yesterday, incarcerated for hitting someone with his taser. So it is something being done about it.
Oh, wow.
And very good question.
And thank you, officer. Thank you, Sergeant, for coming in. And if someone has a question, because you were saying what to do when you have a police incident that you feel has gone wrong in some way, who to reach out to. Is there a number that you have, or
Yes.
an easy way to start that process?
First of all, everyone has the right to ask for a supervisor.
Okay.
You have the right to ask for a supervisor. I could get a sergeant, lieutenant, someone to come around there at a time. But if not, dial 630-0500. That's our non-emergency number. That's the best number you can learn. And they will transfer you to our internal affairs department. And our internal affairs department will handle it. Just ensure and stay on your level of respect. A lot of things that I've seen with these cases is that when we investigate them, you find out that the officer may have been on the verge or may not have done something violently wrong, but they may be out of compliance with the policy. But what changes that is when you as a citizen operate outside and you go against the officer. That minor thing that the officer did, it could have been corrected, but now it is overshadowed by the decision that was made. And now you're fighting and tussling with the officer. It's going to be hard for that complaint to go through. I'm just being honest.
Okay.
Yeah, I have one question. Officer Henley, thank you so much. My question is, and I'm being a realist as well, but how do we get, it's relational. I believe in relationships. Relational. There's a fear with this badge now. How do we get policing back to our neighborhoods? Uh-oh, are we there? You still there?
I'm here.
Okay. Yeah.
I'm here.
How do we get back to the basics in our neighborhoods where the policeman, we know the officer in our neighborhoods with our young children growing up to respect? And then even the ones who are selling drugs, they see you, they know that they have to do right. So how do we get clean cops, clean hand cops back in our communities to be a part of us?
Very good question. One of the things is, like I said, a lot of times I deal with the dignity of the heart. I love Jacksonville. I'm a community person. If anyone know me, look up my record. I'm a community person. And I think one of the things is we get other good qualified applicants, especially people of color that care about their community. You talk to a lot of young people, they don't want to be a police officer. Can you imagine, just let's be real, outside the uniform, but can you imagine Jacksonville Sheriff Office not having a Black police officer? But that seemed like the level we're going because no one do not want to be a police officer. There are some good African-American men and women that's out there, besides other colored people. But there are some actually good ones. And when you get those, then you automatically get some of those ones that have a heart, just like I, that will go in the community, that will come on, man up, voluntarily, no pay, because they care about their community, they care about their race, and they care about their communities. So how do we get it? But I think it also starts with the community, and I'm just gonna be honest. And I get a lot of people that say, thank you for your service. You know what color people I get them from? More so Caucasian. And I'm not saying it's a bad thing, but we also have to help raise our kids to have a love for the police. And when they have a love for police, then some of them may have a desire to be the police. When they have the desire to be the police, then they will have the desire to get back in the communities like we had once before. But some police officers are in the community, some in the community. But to get them back, I think that's going to go with some more change in with leadership pushing these things down for us to get in the communities. But once again, who want to push somebody in the community when you don't want to be there?
That makes, hey, Sarge, oh, and another question came in, and the question is that they feel that once Black officers become officers, there's no more black, it's just blue. Oh, do you have any thoughts about that?
And once again, is that when you see, well, first of all, there are bad apples anywhere. But for the most part around, I've been in this agency for over 20 years, 23 years working with this agency. And really, honestly, it's not that. It's more of us, white officers, Black officers, care about this community. Really, honestly, I wouldn't be here. I get to retire at 20 years. I'm still here after 20 years because I want to see a change in our communities, but I love our communities and I love this agency. Do we have issues? Yes. Are we perfect? No. And I'm not speaking from a politician. I'm speaking from realness. But there are some that do hide behind the badge and they do become different. But for the majority, this is in our heart. This is our life. Because outside this uniform, we are Black men. We are Black women. We are on our opposite color. They're white. They are human. So for the most part, there's a great love that we have for our community. It's just you have some people that distresses this uniform and badge, and it makes it hard on all of us.
Yes, sir. One last comment. The news media is telling the story. That's the image that our Black children are seeing, and they're not good cops. So my challenge to all the law enforcement people, you got to tell your own story. You have to counteract what the news media is putting the fear in. And that's how white women voted for Donald Trump, because of the fear of protection in their communities. They wanted protection in their communities. We want the same thing in ours. So you got to counteract what's being put in the face, the fear that's projected by these news media, and you have somehow got to counteract that, if for the gain one way to gain the respect.
Yes, and I 100% agree. I'm not at the highest level to make some decisions. I'm just being candid. I'm just being honest. But with my officers, we're out here. One of the things that I oversee POW, Police Athletic League. So we're involved in young people's lives in a positive way. We enrich young people's lives every day. And going to certain areas, challenge communities, working voluntarily at schools. We are involved, and you're right. We have to tell our own story, and we have to find a way to get this story out. But there are some things, it is what it is. And because I represent the Jacksonville Sheriff Office, there are some things that I would love to speak on, but I'm just not the highest level to speak on those things. But at the same time, I'm at a level where I see a difference with a lot of my brothers and sisters, and we do care about the community, and we out there, and we need to find a way. I just wish I was at the highest level that we can get that story out.
Wow.
Hey, can I ask a question?
Go ahead.
Yeah,
I had a comment. One thing we have to understand too, it's a simple respect for authority. Yes, the badge may not always be right, but sometimes disrespecting authority wins over that, because as my mother would always say, there's two sides to a story, and if one man's telling the story and the other person is not telling the story is not told correctly. So we have to be able to understand authority as well, not just expecting for the Black community to be respected. We have to show that respect for authority as well. So that's one thing we have to do too, not just saying, hey, the police has to do this, the police have to do that. We as a community have to respect the police as well, wrong or right. But as the officer said, when they're wrong, we have to report those wrongs. But when there's one officer reporting the wrong, the true story is never told. So we have to be able to stay alive to get the story told where other people can hear the true story, not one side of the story. I'm done with that comment.
And that's true. And that's why I said earlier, we have to respect, even when the officer is not showing the respect, we have to respect. Because one thing about it, Black men are filling up privatized prisons. And if you do not know anything about privatized prisons, look them up.
Exactly.
They are making money off African Americans. Now, granted, everyone in prison is making money off of, but African Americans are filling these prisons up. We have to bring a change to this. We have to bankrupt the prison system. The way we bankrupt the prison system, we have to stay in a positive light. I know we want to release frustration, but we have to stay in a positive light. We cannot play the game of the enemy. We cannot play the game of the devil. We have to play the game of righteousness. And righteousness will prevail, especially if you have a faith like I have a faith. Righteousness will prevail. It's going to take time, but I guarantee you'll be victorious.
Thank you very much, Sergeant.
Can I just ask a quick question? This is Jeff Turner. I just wanted to ask, and I agree with everything that's been said, but one thing I wanted to know about JSO is there a policy or a practice in place where there's more cross-cultural engagement with the community between the police department? We quite often attend meetings like this, where we will invite an officer from JSO who's of our same race, our same culture. We have that connectivity. We have that history from a racial perspective. So there's almost an understanding of each other even before the meeting begins. Is there such a dynamic where you might have a white officer coming in and engaging in a meeting like this so that he gains more understanding of our attitudes, our behaviors, our tendencies, especially as it relates to officers who are engaged in some form of a interaction with a suspect, what our tendencies might be, and getting a deeper understanding of the Black mindset as it relates to that situation.
You know, that's a really deep question. And we're going to have Officer Henley back to really get involved in those super deep questions. So if you can either hold on to that for the next time, we will be having Officer Henley come back because we do have to move forward with the rest of the event today. So we only could get this little tease. I apologize. That was such a great question, but we got to let Sergeant Henley go at the moment, and we have to move on with the presentation today. But thank you very much for the question.
Thank you, Sarge. Thank you.
Thank you.
Thank you, Sarge.
Great
Yes.
job. Thank you.
Great.
Yeah.
Appreciate what you're doing.
Yes, and if you ever want me to come speak, you can do it richard.henley, HENDLEY @jacksheriff.org. That's Richard, RICHARD .HEND as in dog, LEY @jacksheriff, JAXSHERIFF.org. I'll be more than happy to come and speak to your congregation. I'll speak to some people in your community.
Great. Thank you very much, Sergeant. We appreciate you.
Yes.
And for your service.
Thank you.
So our next guest speaker is going to be talking to us about spirituality and medicine. And we've kind of talked about spirituality a little bit, but Dr. Barry Wright is a hospitalist with Baptist Medical Center and president of the Northeast Florida Medical Society. And he's going to tie some of the spirituality in medicine together for us. Dr. Wright?
All right, thanks a lot, Matt. Is everybody able to hear me okay also?
Yes.
Yes.
All right, and I'm gonna try the screen share and see how it works out. All right.
You can see it.
Looking good here.
All right, great. Yeah, I thought I was gonna have to card Officer Henley for a second. He kept on talking about how he's been an officer for 23 years. I was like, he can't be 23 years old. But,
yeah, you look real young, right?
Very young, but yeah, obviously the years have been treating him well. But the topic that I'm speaking on, the spirit in medicine, I'll say, I've been a physician for, almost 10 years now, as you heard on the also one of the things that wasn't mentioned, 1 year ago, I actually got called into ministry. So in that journey, I've been seeing the integration between spirituality and medicine. I think the trend of medicine has become more progressively and, more definitively geared towards treating the person as a whole, not just as a set of diagnoses. So as a whole, kind of what the psychiatrist alluded to, mind, body, soul, and spirit, all of those being absolutely important in order to facilitate the best health of the individual. So, this presentation, I'll go over some of the history, about spirituality, and the merger between medicine, some scientific studies, also, testimony, and then practical relevance, what you can take away from this, that you'll be able to integrate into your life. Although this is just kind of touch on the surface, you can obviously go as deep as the, ocean on this matter too, so. We know that within our community, we've had very strong challenges. I think Dr. Williams mentioned this on, getting access to medical care. A lot of times it's attitudes, dispositions, based on the history of, trauma we've had in the past. I'll say one benefit, this is something that everybody can engage on their own time, 24 hours a day. There's a benefit that can be reaped without necessarily making an appointment. So many of you are familiar with this story. So the first moments recording the merger between the two, a lot of you know the story of Moses. When the Israelites were in the desert, one of the challenges they came upon was poisonous snakes. So God gave Moses insight. He's like, hey, take this rod, put a bronze snake around it. All of the Israelites that look at this in faith, they'll be healed. So that period was probably around 1300 BC. Later on, several hundred years later, in Greek mythology, they began to adopt this same symbol. There was called the rod of Asclepius, and this was something that was actually associated with pagan traditions within that context. But ultimately, this symbol, which originated from Moses, became adopted into current medical symbology. You can say it's one of the official symbols of medicine. So the first public hospitals were actually monastery based. They were built in cathedral towns. It was a Christian initiative. Even later on, when other cultures began to take over, say Persia began to kind of spread that empire, there was a Persia school of Edessa or Academy of Athens. So they taught Christian theological and medical insights at this university. Later on, we also see that the first Spanish hospital was actually facilitated by Catholic Visigoth bishop in 580 AD. And then even the root of the word comes from French origins. One of the terms that's fallen out of use, but they used at the time because it was so intricately merged, was Hotel Dieu, or Hostel of God. You may notice the gladiator on the left side of the page. So the first, I suppose, medical sort of facilities were actually in the gladiator stadiums. So after the warriors, got pummeled or whatever happened, they got patched up in that. So that would be the first, where they started to record medical care in a sort of facility, but that wasn't something that was available to the public. So now these hospitals, they provided hostels for travelers, dispensaries for the poor, that housed people that didn't have access to that. And they also provided clinics and surgeries for injured, to where spiritual interventions and medical interventions would be facilitated. We started to see somewhat of a separation around the time of King Henry VIII for financial reasons. So he actually said, hey, you know what? All these monasteries have a lot of land, a lot of wealth, a lot of property. If I shut them down, I can take it. And you can see by the picture, he became somewhat of a fat cat. But then also we saw with the period of enlightenment in the 1700s, people started, moving away from religion, in the name of science additionally. So, this continued to progress into Western civilization. Hospitals, even for the next thousands of years, were initiated by Christian institutions. The Office of Nursing, those are provided by Christian organizations. These places provided medical training. They licensed physicians, to practice medicine. They continued with innovations in technological interventions, but also religion, spirituality, and medicine were still intricately merged. So now, is there a role for religion and medicine today? 55% of doctors, when surveyed, say they've seen miraculous treatment results. 73% of US doctors believe miraculous healing occurs today. That's out of 1,100 physicians. 59% pray for individual patients, and even more encourage their patients to pray. So they've actually, in order to further research this, they've done meta-analysis, essentially took a number of studies over the course of decades, even facilitate their own studies. And what they found was that, frequent church attendance was associated with a 23% lower mortality risk. This study was repeated in other instances with similar results. And by church attendance, part of it is associated with the intrinsic importance of religion and, actually facilitating some of the practice, whether or not it's prayer, ingesting the teachings of those sort of things additionally. So this is a personal friend of mine, Dean Braxton, one of the miraculous accounts of medicine and spirituality. He went to the hospital due to a kidney stone. Some people say it's as painful as having a child. But, in this course, he began to develop kidney failure, a severe infection requiring IV antibiotic therapy, respiratory failure requiring a breathing machine, cardiac arrest requiring IV medication to keep his heart pumping. So his critical care management continued to progress to the point that he actually died. As the doctor that took care of him at the time, he was one of the top 10 doctors in Washington. He said he was really, really dead. And, by that, I mean, his extremities were cold. He had bluish, purplish discoloration. As he was talking to his wife, he told her, hey, even if there's any measure of recovery, that comes out, he'll essentially be in a comatose state with multi-system organ failure. So it's like, there's no use essentially in trying medical intervention. So he was actually dead for an hour and 45 minutes. She understood that. The next thing that she did, she leaned on her face. She, got together with her family, her church team. They prayed very intensively, very fervently. And at the end of that, today, he is a man that is walking. He's talking. He has absolutely no brain damage. He was healed of every single one of the conditions, that he went into the hospital with. So he's a documented and verified miracle. But I'll say not all spiritual interventions are necessarily this. A lot of it is just integrating healthy lifestyle changes, which is probably the most important aspect. Consistent daily healthy lifestyle changes. So how many of you know wives can be pretty intimidating and pretty powerful, as the case with Dean's wife. But of course, I even go to doctor's appointments, and many times I know it's a wife that's keeping things in line. So, the power of a praying woman. All right. So one of the things, we talked about before, this has been strong throughout all of the discussions that we had, but lifestyle is probably one of the most important interventions, leading to good health, leading to healthy finances, healthy family, healthy community, respective police officers, all of these things. In 3 John 1 and 2, it says, beloved, I pray that you may prosper in all things and be in health just as your soul prospers. So that's, of course, the intent of the word. Where does that merge with science? There's a area of study called epigenetics. So you have your DNA. Dr. Washington referred to this. DNA is basically your inherited set of genes. Epigenetics is those set of genes that are actually expressed. And what they're finding is that our lifestyle, our behaviors, those things that we're exposed to, even our mental state, is impacts epigenetics. If our epigenetics are optimized, reduces our risk of inflammation, of cancers. It reduces our risk of diabetes, a lot of other things that, it impacts. The other thing for lifestyle, we know that within the construct of a spiritual organization, people have a social support. That's very important, particularly within this environment. We see that isolationism, has been the result of COVID in many ways. That adversely impacts mental health. People don't necessarily follow up with their family, their friends. So when they need critical assistance, they may not get this within the that's one of the mechanisms that we see that helps with individuals. The other area is behavioral psychotherapy. So there's pills, which psychiatrists will frequently use, and they show that with behavioral psychotherapy or cognitive behavioral therapy, that's as effective, if not more sustainable effect than just simply taking a pill. And these are a lot of things that you can ingest within the contract of ingesting what we call the living word. And of course, with risky behaviors, a person that's spiritually grounded may not, spend all their money on drugs and alcohol and not have enough money to buy their, medications, their diabetes medications. So also in Proverbs, it states, a merry heart does good, like medicine, but a broken spirit dries the bones. So, I've talked to, Christian counselors, and one of the things that they tell me, having been in the secular arena and also the contemporary arena. So with their psychological assessment model, they indicated that Christian counseling was associated with the 90% improvement in outcomes, as opposed to only a 35% improvement with secular outcomes. And, we know this is something also that the individual, they have the power, with these words to kind of take this on themselves, to have it transform their thinking, transform their behavior. And as it transforms their behavior, it transforms their future and their destiny. Also, we saw a significant reduction in heart disease. A few things that we saw it impacted were body mass index, essentially your weight, high blood pressure. Individuals, that had religion integrated within their, daily living had less, issues with blood pressure, inflammation, as assessed by inflammatory markers, which would impact stuff like rheumatoid arthritis, also autoimmune diseases like lupus, mental illness. The other thing, which was an anomaly, was that diabetes apparently had less control. But I don't know if any of you all have ever tried to refuse pie from a lady in the church. That may be able to, explain that anomaly. The other thing we saw was that with immune deficiencies, we saw there was significant benefit. So they followed HIV positive patients, that had religion integrated in their practices, and they observed that they had a higher CD4 cell count, which is good. So basically that made them more resistant to the virus, more resistant to diseases. And, as discussed before, it also helped to reduce inflammatory markers. So now end of life, we've noticed, and I think this is something anyone can attest to, in Jeremiah, it says, the thoughts I had towards you are of good, not of peace, not of evil, to have an expected end. People that are grounded in their faith, we know have easier time with this transition. Generally, they've made peace with their family, they've made peace with themselves, they've made peace with God. Enables this transition, to be, more fully or peacefully realized. I'll say my personal testimony, even with my mother that passed away, 2 years ago, when she passed, it was a, peaceful passing. God was generous enough to the extent that I knew 2 days, in my spirit that she was going to pass. Same thing with my brother. Things have been facilitated well. We had even had a family vacation. Even the site that we picked out to bury her, we were at the burial site before we had ever picked out the spot. I walked by the spirit, to a plotting ground, and I said, this feels like where my mother should be buried. I talked to the individuals that owned the plot, and they came to me with a paper, to show me areas where she could be buried. And the spot that I was standing on was the last plot, that they had in that particular area. So, I'll say there's plenty of people probably have, great stories like that. But, overall, John 10:10 says, I came that you have life and more abundantly. So we know the things, according to studies, that having religion integrated in your daily practice implements. One, you live a longer life. It's shown to have mortality benefits. You live a healthier lifestyle because you're less likely to engage in risky behaviors. You have a network of support, which also helps with longevity, with health. The church is one of the bedrocks of the community in any city that you go to. You get education, educational access, even through the word, also through your church. Even events like this, where a lot of people of faith, are the ones that have a heart to serve. And then also financial benefit. If you have self-control, due to, having ingested these principles, that's probably going to make you less likely to gamble or eat out every day trying to, fill other deficits. But a few resources, there's plenty more. Testing prayer, Candy Brown, her husband is actually an acquaintance of mine who was miraculously healed from a brain tumor. He's a neuroscientist. After trying every medical intervention, the Case for Miracles by Lee Strobel, and also the Global Medical Research Institute, which continues to study these things. And here's my organization, the Northeast Florida Medical Society, when we did a mission trip to Jamaica, which we try to do annually, raise money to do the same. But we had the same mission to continue to educate the community, to continue to encourage clinicians towards excellence in community health and practice. And, to see events like this, continue to spread.
Now we get to switch to Chef Amadeus, and he is in the middle of his cooking demonstration. Hey, Chef, can you hear us?
Yes, I can hear you.
Ah, there you go.
So, welcome. So, my name is Chef Amadeus. I'm born and raised here in Jacksonville. And when I was asked to do something healthy that was fun to do and quick and simple, I decided to do baked chicken, baked beans, and a potato salad with a twist to it. So let's get started with the chicken. So, you know, we want to make sure that you have, even when you're cooking, I don't like to call it healthy, but cooking extra good. Uh, so what I did was I seasoned my chicken with one of my spices. It's called Lil Bump. There's no salt in it. And one of the things that you have to understand is none of my spices have salt in them, but it has a lot of flavor, okay? As you see, I'm putting my chicken on a cooling rack. That way your chicken is not cooking in the fat. So all the fat is gonna drip down and you don't have to do that. So we have, the other one I have is a Southern rub, and that's going with the chicken wings. And I marinate these for about 4 hours. There's no salt on these. Like I said, this is just literally just what it is. Both seasonings. So go and get this and put it in the oven. Oven's at 350 degrees. So while we cook everything else, we're gonna go from there. So the next thing I want to do is the baked beans. So when everybody does baked beans, it's always, you know, the bacon that goes on top and lots of sugar and all these things that we shouldn't have so much of, but that's just the way it is. So what I've done is,
because it tastes good,
we're gonna add some flavor to this. So we're gonna add some olive oil, and then we're gonna get this is a seasoning blend. Get in the freezer, section. It has celery, onion, peppers. So you don't even have to use a knife. So you're going to get this. And then we're going to season it. So one of the things I like to do is season all the way through my food. Like with the chicken, I didn't just season the top of it. I seasoned underneath the skin. All that flavor is underneath the skin. So think about this. You got the chicken skin coming, the juices coming down with flavor. So it just makes everything a lot better. So the Lil Bump has black, white, and red pepper, oregano, thyme, basil, onion, and garlic. So that's everything you need to season something. So we're gonna get this and season it. And when we season this, as you see, as we go along, you'll see how much I season. So now, while that's cooking, next thing we're going to do is get our baked beans. So now baked beans have flavor. So these beans came, what'd you say?
What kind of beans do you use for your baked beans?
So, well, because I want people to be, to not spend so much time in the kitchen, if you get your favorite baked bean in the store, what I did was I poured off the juices from that, but it still has a lot of juice in it. So as you can see, this is what it looks like. Now, instead of adding sugar to all this, we're gonna add some agave to make it sweet. Okay, so then with that, now here's some alternatives I've seen people do and I've done it myself. So remember now, you can do everything to do, add mustard to this. You can add, if you want to add meat to this, you can add in some ground turkey to this. Okay, I've seen it's still adding bacon to it because people like that meat flavor in there. Add some ground turkey in there, and that'll be your baked beans. Some people, and you can put this in the oven and just let it slowly cook. But for those that want some baked beans real quick, to go on, with their ribs or anything, this is what it is right here. So we'll let that simmer. So now we're going to get to the potato salad, which is going to be a lot of fun. So I changed my eating habits. I started eating a lot less meat and more vegetables, and because I have kidney issues and heart issues, I changed completely how I eat. So I like potato salad, but I can't have potatoes because of the potassium that's in it. So I make it with cauliflower, and you get the cauliflower, put it into some florets. As long as they're the same size, you're good to go. So you add that to your bowl. Now remember, this is literally like a potato salad. You don't have to change anything in there but the potatoes. So we're gonna add in some mayo. Now keep in mind, when you're making this, what I want you to do is to add a little bit more zing to this. Is you can do make your mix up ahead of time, let it sit in the refrigerator for about an hour or so, and then mix it in with everything. So we'll add some mustard. Like I say, the same thing you would normally do. Now, I got peppers and onions and celery in here as well. We got a sweet relish. And we got a diced egg. So now, all you do is mix it up. And of course, I have, when you have that good potato salad, what's the one thing you top it with? Is smoked paprika. So I actually have adding smoked paprika to my line of spices because I've started cooking more and more with that. And as you can see this, let's make sure you guys can see all this. There you go. So it looks like your potato salad. And like I said, if you want more relish in here, you can do that. That's not a problem. So then what we're gonna do, add this to our bowl. And then we're gonna top it with some smoked paprika. So there you go. That's your
question. Did you cook the cauliflower any, or it's just raw cauliflower?
No, the cauliflower has been steamed. So when I say steamed, what I did was I cut it into florets, put it in, I boiled some water, bring it to a boil, and then drop your cauliflower in there and put a lid on it and turn the heat off. And that way you don't have to worry about overcooking the cauliflower because it slowly cooks.
Okay. So you don't want it to be, would you say, you just let it sit in the water until you're ready to make the cauliflower salad?
No.
So you let it sit in there for about 15 minutes, or just however until it gets fork tender. Because when you make potato salad, you don't like people that have mashed potato salad. Exactly. So with this, that's why you put the cauliflower in hot water at the boil, put a lid on it, turn the heat off, and let it slowly cook. And then what I did is I took it out and I drained it. Okay. So now.
Got it.
Yeah. So this is what the baked beans look like. Now, if you want to really have some fun with your baked beans, this is what you do. All you folks out there that make that hot water cornbread from scratch, here's the thing. We want you to make it clean. Clean means you just cook everything from scratch, not from a box, but from scratch. You literally can get your cornbread mix and drizzle on top of this and throw that in the oven and let it cook about 15 minutes. So now you got cornbread and baked beans. So yeah.
Oh yeah, that's eating.
And then
Yeah, that's eating.
it looks like.
So we get to, and Chef, you're gonna give away some of your spices for our next door prize?
Yes, I get some spices away.
Ah, that's what I'm talking about.
We have the Southern Rub, we have the Chino 5, and we have the Little Bump. The Little Bump is an all-purpose, has no salt in it, and I use it for everything from my grits to just a plethora of things. Let's go with everything. And then now that the holidays are coming up, this is great for your coffee, your hot chocolate, sweet potato pie, pumpkin pie, just anything you use cinnamon with. You make those Christmas cookies, those baked cinnamon cookies, ginger snap cookies. This goes great with that. And then the Southern Rub, we down here in Florida football. So this is amazing for tailgating, for your ribs, your chicken. I've done it on steaks. Now, here's something else that I want to show you guys. So this has the Little Bump in here. It has the Chino 5 in here. It also has coffee and brown sugar. Okay. The great thing, the coffee that's in here, the reason I put this coffee in here, because I wanted, I like that smoky flavor. But the other reason is this is the same coffee that my grandmother used to drink when we were young. And so I wanted to pay homage to her. For those that are diabetic and can't have a lot of sugar, here's what you do.
Is one of them spicy? I'm sorry, I didn't mean to interrupt.
Oh, the Little Bump has a little spice to it.
Okay.
So, but here's what you do if you're diabetic and you can't have this one. You get the Little Bump and the Chino 5 and season the ribs with it. Season them very heavily. And then put them on the grill, smoke them however you cook them. And then right before they're done, you get some agave and smear it on top and put it in the oven and let it bubble and sizzle on top. Now you have the same effect with the Chino 5, but you're using agave instead of using brown sugar.
So it gets that like that more like a glaze.
You get that sticky, you get a sticky feeling to it. You know, when you have to lick your fingers. So that feeling to it. And like I said, it has a lot of flavor in there. And here's the other thing, because these are all spices and herbs, you're getting the full spectrum of what cinnamon is good for, what star anise is good for. You get all this. Because like the star anise, I actually have star anise, the leaves from the star anise, and I make a tea with that. So I make a star anise tea. I get the onion. I make an onion skin tea.
Oh, nice.
Bay leaves, bay leaf tea. All those are good for your immune system, and it's just good for you.
And if someone's not lucky enough to win a door prize today, how can they get them? Because I know all of us are thinking, I know I'm going to have to order some. So where am I going to have to go to get these?
So you get these from chefamadeus.net. And like I say, just go there and all my information is there as well. How to get in touch with me and all that good stuff. Now, instead of, you're getting ready for football season, tailgate and everything, instead of using chicken for this, you can do other things, other meats. Like if you like, sausages on the grill, instead of using the pork sausages, you can use the Italian turkey sausage, the chicken sausages. And what you want to do is read the label and see what the sodium content is in there. Because here's the thing. There's no salt in this, in the potato salad. The salt comes from mayo, the mustard. You see, that's where that comes from. And then with the baked beans, it just came from what was in the bean can, but it's less because I didn't use all the liquid in there.
I got you.
If you want more flavor and more juice in this, get a vegetable stock and put that in there. And get the one that it says it has no sodium in it, but it has like 3%. but 3% is a lot less than 26%.
I got you.
You see what I'm saying? And then think about this. When you sit down and watch the game, you're gonna be drinking beer anyway, so it goes out the window. So you gotta have a balance. You know what? If you want to be, if you want that, cut back on the back end. So on the front end, you get what you really want. What you really want is a beer. So these dishes here will give you the opportunity to have that beer.
Chef, do you offer cooking demonstrations for, say, a smaller family? Some folks have families with different chronic health conditions. Do you offer that as an option to, you know, maybe come to my house and show me and my family how to cook healthier?
Actually, I do that, as well as I do virtual classes as well. Same this way. And because of the pandemic, that's
true.
It's been a lot of fun to do the virtual ones. and because I have a lot of issues, health issues myself, I've done plant-based, low sodium, potassium, the whole 9 yards. So when I'm teaching these things, this is the way I live my life. And big things I always tell people is read your labels. Read your labels, because if you don't know what you're putting in your body, then that's not a good thing. So I cut down on my salt, but I can tell you the sodium content in the candy that I eat.
Wow.
In the chips that I eat. And when you're buying these things, turn the bag over or whatever and look at the label. So if you want a salad and you go to the aisle and you get salad dressing, and you think you're being smart by getting a light, don't do that. You might as well get the regular one, because the light has more sodium than the regular one. Now, if you really want a salad dressing that's already made and you don't want to make one, go to the produce department and get the one from the produce department, because that one has an expiration date that's coming up real soon versus 5 years from now.
That's a great point.
It has less sodium in it.
It has less sodium because there's not a lot of preservatives in there. That's why they put it in the refrigerated aisle. That's why you can put that on the shelf for 5 years and nothing's gonna happen to it. Okay.
Got a quick question for you. Want to go back to the sausage. Have you ever made sausage? Is that a healthier way to do it? Instead of, maybe using more vegetables in it?
So,
what quick tip can you give us on that?
So when you can make your own sausage, and the way you want to do it. Now if you're gonna make your own sausage, have some time. This ain't like I'm gonna bang this out in 30 minutes. No. But the great thing about it is you know what's in there. So you can make a chicken sausage.
Right.
And here's the thing, when you make chicken sausage, you can put in there caramelized onions, broccoli, corn, whatever you want, because you make it yourself. And then
I was thinking of a patty, chef, instead of the link, because the link you have to worry about the casing.
Well, it's the same thing. Kind of, but we'll skip that. But if you make a patty, I don't have a cup. Yeah. So with a patty is make up your mixture, and then what you want to do is get a lid from like your mayonnaise jar.
Okay.
Something about that big. And what you want to do is make your mixture up, season how you want to season it, and then put saran wrap on that cap. Put your mixture on the inside of there and mash it down, and then fold the plastic over like that, and put them on a sheet pan and put it in your freezer and let it freeze.
Okay.
You got sausage, you got chicken sausage, you can make a vegetable patty the same way. When you make a vegetable patty, a lot of people think it's hard to do. Literally, all you can do is go get a bag of mixed vegetables, put it in a blender or food processor, add some oatmeal, a little bit of olive oil, a little bit of seasoning, and just turn it up, and it's gonna come out like a mixture. And you do the same thing. Put your saran wrap over the cap, put that in there, fold it over, put it in the pan, put it in the freezer. Now you got veggie patties with no preservatives in there.
Did you say oatmeal?
Oatmeal.
Helps stick it together. Yes. Yeah.
It serves as a binder.
like a binder. Yeah.
And keep this in mind, when you're grinding up frozen vegetables, there's liquid in there. So that liquid combines with the oatmeal, makes a binder for it.
Okay. I know we're running out of time, Chef, but I wanted to ask you, get back to those yummy, scrumptious chicken legs you put in the oven. So can you just wrap it up and share with us a quick way to make some good, healthy chicken wings or chicken legs for those of us who enjoy our football on Saturday and Sundays?
Well, a couple things you can do, real simple. If you want, like, I know a lot of people like Italian dressing, put their chicken wings on, everything like that. Well, if you make your own Italian dressing, it's the same thing. So you put oil, vinegar, some a little bump in there, wind it up, put a touch of agave in to give it some body, and toss your wings in that and throw them on the grill, throw them on the smoker. Same thing with chicken, with people like fish right now. Olive oil, lemon juice, and a little bump. And here's the thing I was telling somebody earlier. If you wrap it up in like cabbage or whatever, put it on the grill, you're good to go.
Nice.
So
easy to do.
Did you say wrap? Are you wrapping your chicken or your fish up in cabbage?
The chicken, I mean the fish.
Okay.
So we have chicken wings. There you go. So that is baked beans, chicken, and potato salad.
What about a sauce to put a healthy option for a sauce like a buffalo sauce on the wings? Is that a possibility to make healthier?
It is. So, matter of fact, I have a channel on YouTube. Look up Chef Amadeus and a Laotian paste. If you like something spicy, all it is mushrooms, serrano chilies, and garlic. That's all it is. Drizzle with olive oil, throw it in the oven for an hour at 350 degrees. When it come out, chop it up to a paste. And now you can add olive oil and vinegar to that, and that'll be your sauce for your chicken.
Wow.
Fantastic.
Peppers are hot.
Well, here's the thing. You can dilute it down to heat with orange juice, grapefruit juice, apple juice. So yeah, chicken broth, but I like the fruit juices for that.
But they do have a nice flavor.
Yeah. So this is everything that you guys can have for a great football game, and it's pretty much a little healthy for you.
Yum.
So, any more questions?
And anyone? Jocelyn, those were great questions. I see you cook. You know your way around the kitchen.
No, I actually had a conversation when Chef was talking about wrapping the fish in cabbage. He also told me for those collard green lovers, you can wrap your fish in collard greens. Now, I don't know how many of you have ever thought about wrapping fish in collard greens, but that definitely makes for a healthier meal option.
You blanch them. I guess you would blanch the greens
If you guys
first.
have any more questions, you just reach out to me on my website, chefamadeus.net, or if you want, go to my fan page on Facebook, Fans of Chef Amadeus. Go there. I do a lot of things on that fan page that I will do on my regular page. So it would be a little interesting if you went over there and got something and follow me on my fan page.
Hey, Chef, thank you for your time. We really appreciate having you today. And that food looks good. Thank you, everyone, for taking part in today's event. I want to make sure that everyone is aware that the speakers will be back, so you'll have other opportunities to meet with them and talk with them and get a better understanding of some of the topics Their information is going to be on the chat page, so you can find how to reach them there, their contact. And Reverend Williams? Are you
Yes,
back?
I'm here.
There we go.
Yes.
Is there anything that you'd like to add, sir?
Again, we want to thank all of you who joined us on Zoom this morning, as well as on Facebook. This really exceeds all of our expectations. We know that men do have difficulties in going to doctors, and we pray that something this morning was shared that will motivate men to maintain their healthy lifestyles. We want to thank AARP for being our primary sponsor, Nova Nordisk, allowing us to bring Mr. Otis Anderson, the Jacksonville Medical Society for their sponsorship and their sharing with their members. And all of you who joined us today. We ask that you share the links on Facebook. We have the recording, so even though we may not have had 100 persons on the Zoom call, we at least had outreach to our Facebook pages so that this wonderful information can be shared with others. I personally want to thank Jocelyn Turner, who is our Executive Director, for her work with the committee. I want to thank Dr. Fitness for his hosting and his moderating the program today. Like I said, I am on cloud nine. I thought this was a great presentation and a great day. So please share with your friends, let them know that we are here, and we're looking to do other events in the upcoming months. You can go to our website, healthyjacksonville.com.
There are a couple other people that I would like to acknowledge. I'd like to thank Kendall McCrae for his work with updating our website. Again, as Reverend Williams mentioned, healthyjacksmen.org. If you would, stay tuned to that, and also continue to connect with us on Facebook. I'd like to also remind you to alert family members that you know that it is open enrollment for whatever insurance plans that they are looking for. The Affordable Care Act is still an option for folks. You can reach out to the Northeast Florida Health Planning Council for more information on that. And again, we will put that in the chat, and we'll post it on our Facebook page. Would also like to share with those persons who may have difficulty paying their rent that because of COVID-19, the Centers for Disease Control has an eviction moratorium that offers assistance to people who need help with paying their rent, and really to save them, quite frankly, from being evicted. Although the city of Jacksonville and a lot of communities were helping people with avoiding eviction, that may have expired. However, federal law has mandated through the Centers for Disease Control's moratorium on eviction, that option. Check Jacksonville Legal Aid website for more information, and we will also post that information on our Facebook page. And lastly, I'd like to share that One Church, One Child is looking for mentors. We had a lot of great guys on today. Please consider mentoring a young man. You heard from the discussion with the officer that establishing relationships, helping young men to understand the importance of being respectful to themselves and others is very important and a key. And so if you would please take time, look for One Church, One Child. I'm having connectivity issues. I would share that with you right now, but I will definitely make sure that I send that information to you all in either an email for those of you who registered on Zoom. We do have your email address, and we'll send that information to you as well. But consider mentoring through the One Church, One Child. If you are a member of a church, get your church family, guys at your church to also volunteer. Thank you again, everyone. And I guess the final thought that I'd like to share with you all is take care of yourselves and the other men in your life, especially our young men, because the illnesses that many adult men have today could have been avoided, as you heard Otis mentioning in his presentation, had he taken better care of himself while he was younger.
Wear your mask.
And wear your mask.
Yes. Great. And it was good. In the presentation in the beginning, make sure that during the holidays that when you're with your family, to keep it small or outside, and definitely wear a mask.
Thanks, everybody. Have a great day. And thank you again.
Thank you.
Thank you. Great job.
What a great forum.
Appreciate you.
Thank you.